people at home are seeing the big room, they're not seeing those
Yeah.
people real close.
Okay, but we're seeing. Okay. All right. So thank you all for coming. We appreciate those. We know some of you have driven quite a ways to get here, and we very much appreciate that you do that. There's sometimes a lot to be gained by being in person and seeing old friends and making new acquaintances. So we hope that you all will introduce yourselves to everybody. Maybe after the event's over, grab someone for lunch that you might want to form a relationship with or renew an acquaintance. So thank you for that. I want to thank Pete and Donna Miller. Pete's in the back and Donna's over here. I think for probably about a decade and a half or more, they have been faithful partners in filming all of these events, and we then end up putting them online for those that can't participate. Pete and Donna are integral to all the veterans work that I do and have been from the beginning, and so we are very appreciative that they've come again. And I want to thank Carolyn Bevins, who's in the back, and Mike Sheeline, and Carrie Hertel, who help us do all of the behind the scenes. They're my connectors with the AG Task Force. They're the doers that make everything happen. If any of you are not members of the Diversion and Reentry Committee, or you want to join one of the other 14 committees, I strongly urge you to contact Carolyn in the back, give her your email, and tell her which committee you would like to join. We also have a well, it's not new anymore, but we have a jail training committee that we formed a couple years ago, sort of a subcommittee, and then we spun it off to teach jails about long-term injectables and psychotropic drugs. It was a training that's an hour. It's on the Neomed CCOE website, and that started a whole slew, and we are now doing our 9th training, which is amazing. It's on the 20th. It's going to again be run by Neomed, and it's on MAT and withdrawal. We're going to focus on recognizing withdrawal because some of the suicides that came out in that recent report were withdrawal suicides. And then the one after that we're going to do is on autism and disabilities, knowing how to recognize those in a jail setting, because the Montgomery County suicide was an autism suicide. And so we have these trainings. We don't need really more trainings. We need to get all of the county jails and personnel and medical personnel to take the trainings. They're just an hour, so we encourage all of you to look at those trainings. And I want to specifically thank our 3 co-chairs. We usually try to pick one theme. Years ago when we started, well, let's see, this is my 13th year, 8 years with DeWine, and now in the 5th year with Yost on the task force. We used to do 4, now we do 2 because we try to make them actually bigger. And we just had opened them to the task force of 500 members. Now we open them to everybody, and it's really increased our attendance, and then we can let others join, and then they can maybe join one of the task force committees. But Daryl Graves, who's online and not with us in person, Daryl is our co-chair from the Department of Corrections, and Linda Janes is our co-chair from the private sector from Alvis House. She unfortunately had a conference, so she's not able to be here in person, but she's been integral in helping to plan this. And then our real master of ceremonies over there is Andy Leventhal, who's going to be talking a lot about some of the reentry things. He is an amazing guru on jail reentry, which we are nicknaming because he's given us the name. We're nicknaming it Rapid Reentry. And so Rapid Reentry is kind of the nickname. As he will probably tell you as well, there's 600,000 that come out of prisons on reentry a year nationwide. He can give you the Ohio data. There are 9 million that come out of prison. And it's probably a much tougher crowd to deal with because in prison you have a runway, you know they're getting out, you can kind of do some planning. In jail, they could be an hour, a day, 2 weeks, 6 months, which is usually the max they can hold them. And if you don't get them connected with services, as this kind of very educated audience knows, they're going to cycle right back in. So this is just a really important point. So I'm very excited for this task force meeting. I think it's going to be very educational. And I'm going to start by having Andy Leventhal, I always say it wrong, I always say Leventhal, introduce the whole subject matter. Like I said, he is really a master at the data and the statistics. Many of you know that we have a lot of funding that goes to the prison, but the DOJ funding doesn't always seem to necessarily go to jails. So I keep sending all of Andy's data and information and everything up to the Department of Justice to see if they can get more interested in funding jails. And it's been just a very good connection. So Andy, take it away.
My name is Andy Lobenthal. I work for Sheriff Phil Stameti in Lorain County, Ohio. Sheriff Stameti's served 24 years, and he's not running again this year, but I'm pleased to have been with him for a long time. Because of his tenure and stability in the sheriff's office, we've been able to create a program that's known as Rapid Reentry. It started with a case management idea of helping the inmate population meet some needs while they're in jail. And it evolved from that point since 2017 till the present time. But lately, there's been a chance for us to look around and look at some other jails within the state and realize that those of us in jails are doing something unique, and I'm excited about the momentum that we have within Ohio right now, because jail reentry nationwide is not very popular and not widely known. So we're here this morning, and I want to thank everybody for their attendance. My two co-chairs that aren't here today, but this is kind of not in their wheelhouse anyways. This is more of a jail topic, and so we're just going to go ahead and move on without them. Today we have some presenters with us. I have some hardworking folks from Montgomery County Jail, Butler County, and Franklin County, and they will share with us their versions of their jails reentry models. Jails are all unique, folks. Jails aren't the same as prisons, and you need to understand that very early in the process to understand how you can meet the needs of that population, both in that facility and as they prepare to leave that facility and re-enter the community. So a basic definition for re-entry, in case you're not familiar with it, it's just the idea of meeting the needs of those while they are incarcerated to improve their outcome upon release. In doing so, making them healthier, safer, stronger, more sustainable, and doing the same thing for our community as well. So the national numbers look like this, and Justice Stratton alluded to it. Nationally, jails come into contact, book, process into their facilities 14 times as many people as our prison system does. So nationwide, the federal and state prison systems encounter about 650,000 people per year. But nationwide, your jails encounter 9 million. If we as a nation are making inroads with ministering, with intervening in the lives of those people while they're incarcerated, we must understand that nationally, only 1 in 15 ever goes to prison. The other 14 hit the jail, and then they're back on the street, whether that's 2 days, 10 days, 2 months, 10 months. And they didn't receive the benefit of those reentry services, by and large. But they all have the same needs. So, as we talk about this 14-to-1 ratio, think about it like this. Portland, Oregon, up there on the West Coast. Portland, Oregon has a population of about 650,000 people. For reference, Franklin County that we're in here now is just slightly under 1 million. Portland, Oregon, 650, roughly the same number of people as we book into the federal and state prison systems each year. The jails book the population of Los Angeles, Chicago, Dallas, and Philadelphia combined every year. So that's a very large number that you have to keep your mind on when we talk about resources. Well, let's talk about Ohio. Ohio's even worse. The discrepancy is wider. 1 in 20 people that hit the criminal justice system in this state end up going to prison. The other 19 are going to go to your county jail, and then they're going to return to your community. But they all have the same needs: unemployment, education, substance abuse, recovery needs, mental health issues, homelessness, poverty, health insurance. All of those things, those same needs that are present in that population when they go to prison, are also present in that population that hits the jail. But those people don't go to prison, and so they don't receive any of that reentry programming when they return to the streets. Now, mind you, I get it. They're not separated for years and years. The average length of stay for somebody that goes to the state prison system is 2.7 years. The average length of stay for somebody in a county jail within the state is about 19 days. So sure, they're not separated for years and years. They don't have to start over from scratch, but they do have the same needs. And what if you can address some of those needs while they're there, or at least start something for them while they're there, that they can continue in the community when they get released? The biggest difference between jails and prisons is prison populations are sentenced felons. Jail populations are everything. Everything you can think of. From the person who had a speeding ticket and forgot to pay their fines and eventually ran afoul of the law and there was a warrant issued for them, a nonviolent driving violation could put you in jail, at least briefly, all the way up to everything you hear about in prison, all the serious murder, rape, kidnapping, everything else. They all go to jail first. But only one in Ohio, 1 out of 20, goes to prison. The rest are on community control or released back onto your streets. So what we're trying to do is we're trying in Ohio to make a movement here to find out what jails can do and how they can meet the needs of this population. All of this dates back to the 2008 Second Chance Act. 2008 legislation said we have to try to improve outcomes for those in custody and carceral settings. And you can see that local jails are included amongst that. Council of State Governments tells us that 2.2 million people are incarcerated in the United States, are going to need those resources when they come out. Prison or jail, again. 16 years worth of that second chance activity hasn't produced a strong outcome for jail populations. Jail reentry is not well known, it's not well publicized, and quite frankly, there aren't many jails that are practicing any type of reentry programming. On the other hand, prison reentry is the reentry that most people in our community are familiar with, and most people in this room are probably familiar with. These slides and these little pictures represent the advertising of many people who are involved with prison reentry. I just pulled these off the internet in a quick little search and captured and posted. The reason I'm showing you these is because I want you to understand that the reentry that America knows today is prison reentry, but we'd like to introduce them to jail reentry, and we think there's a need for it. Reentry 2030 was launched a couple of years ago. We're hoping to get on and catch that wave of Reentry 2030 and work cooperatively with the Council of State Governments. We've had some engagement with them. But during the past 50 years, our nation hasn't invested a lot of money in jails. They've invested in prisons. It's easier to research prisons as compared to jails. We don't have the same perspective. We don't have the same understanding of jail operations that we do with prison operations. It's harder to get a handle on them. They're all different. Montgomery County's jail is different from Lorraine's, and Butler's is different from theirs, and Franklin's is way bigger than all of ours, and that's what makes them dissimilar and hard to study. A prison system is the prison system, and you can look at all the prisons within that system at one spot of one hierarchy point. In jails, we don't have that. We impact a much wider segment of the population, and so it's important for us to address those needs. Reentry supports are some of the things that we talk about. Healthcare connections. What are these people looking like when they arrive at our doors? When they come to jail, they are straight off of the street. What were they doing in the week or two prior to the day they arrived in our jail? Were they abusing substances? Were they did they have a violent encounter? Was there a crisis. Are they in crisis? So they come to our doors and in many states. And we like to address their healthcare needs while they're there. And of course, we do have jail standards. And the jail standard says that you will provide this predetermined amount of care while these people are in your custody. But it ends there. There is nothing that speaks to, and you will try to get them set up so that they have a better opportunity to be successful when they return to the community. Social services, the same. Mental health in our correctional facilities. I mean, that's what this task force is about, and the numbers are there. I can tell you that the mental health needs in our county jail are one of the largest demands for resources, manpower, and one of the highest risk, highest liability pieces in your jail. So anything we can do to improve those outcomes is worthwhile and something we need to take a look at. So let's take a look at what we have as far as funding examples. Prison system funding for reentry is different than what we have in county jails. We don't have one specific funding source that funds these county jail reentry programs. And that's why they really don't exist in a widespread sense. What we have is creative ways that they have blossomed, and we found a way to make them work. And the only way they will be successful on a larger scale throughout the state or the nation is if there is a more stable funding stream for them. We talk about our funding comes through our budgets from the sheriff's office budget, comes to the commissioners. We do have a piece from OMAS, and we're very thankful for OMAS for their drug reimbursement program. I'll be honest with you, we have an MAT program in Lorain County, and that MAT program would not service the number of people that it does if we did not have support from OMAS for reimbursement for our medication costs and a cooperative agreement through substance abuse recovery for grant funding to support some of the nursing needs as well, and the labs and all the other pieces that go with it. There's another component from OMAS. Tracy Plouk started back, I don't remember when that was, 2008, I don't remember, before my time when I was in there. That is in place and helping some jails within the state also meet some of these needs, creative programs, but this funding is temporary, it's not guaranteed. We don't know how long it will be there. My program in Lorain County is funded through the Mars Board. That's how we get our funding, and we know that there's some of those people in attendance today for some other Mars boards throughout the state, and we appreciate that. Take a listen, see if you can put something together in your own county. And grants. Look, there's lots of grants that come out from the feds. BJA, all the federal programs, they want to help. They are trying to help, but they don't know how to connect to jails. We in jails don't have the same people in place that the prison system may, or that nonprofits have. We don't link well and link cleanly to grant funding. And so we've got to break that barrier, and thankfully Carlton Moore, the BJA director, is working with us. He's listening, and we're trying to make some inroads there. If we had Carlton in place for another 15 or 20 years, I think we would have some good progress made. But as it is right now, at least he's listening. They're trying. I've shown them the disconnect that's there, and they're working on it. But he can't reinvent that wheel in 4 years there. So let's talk about some funding challenges. We've been talking about them briefly already. We don't have the money to minister as widely as we'd like to. The grant funding puts us in competitive situations with one another, and anything that's short term could lead to longevity problems. So you have to be careful with how you build it in your jail. If it's only short term, you don't want to impact your normal procedures too heavily with it. And that was one of the things that we really had to look at in Lorain County. There are no models, folks. There was a model that described jail reentry back in 2009, transition from jails to community. It fell on its face. There is nothing long term that I'm aware of that came out of that could be sustained without heavy financial support it was top-heavy, and they were talking about sentenced individuals for the most part. In county jails, only 20% of our population is sentenced. Everybody else is there waiting on bond. They're waiting to post bond. They're waiting on a court date. We don't know when they're going to get released. And when we talk about reentry, that's one of the biggest problems that we have. In prison reentry, you can work towards a known date. When the person gets to prison, within a couple hours, a couple of days, we know when they're going to get out. I'm going to get out on September 30th of 2026, and now I can start working towards that date. When you're in jail, you don't know that for the most part. 80% don't know. They're gonna, when do I go to court? Who is my attorney? What's my bond amount? And they're dealing with all the baggage that they came in with, and we're trying to help them with that. So Buckeye State Sheriff's Association is also involved in reentry on a different level. Medicaid 1115 waiver opportunity is another chance for jails to get their foot in the door and start meeting the needs of our jail populations before they return to the community. So as jail reentry is growing here within Ohio, and we'll show you by some of our other county jails here today, it's also being discussed at the national level. At least those discussions are starting. So the reentry waiver, show of hands, and just in this room, I know I can't see online. Anybody familiar with reentry 1115? Okay, so we've got a lot of people. So most people are familiar. So the idea is that you're going to start meeting the needs of these people in custody before they are released for primarily, most of the waivers are addressing substance abuse needs and mental health, and case management is a heavy process of it. Well, case management is a lot of what we are doing in jails right now with our reentry programs. So it's a clean mesh. So we are working within the state. The Buckeye State Sheriff's Association is working closely with Ohio Department of Medicaid, Governor DeWine's administration, and thankfully a partnership with Ohio University to get that ball rolling. They are having listening sessions. We want to improve those outcomes. So how are we doing it? We met with Medicaid. We have a questionnaire being developed that's going to go out to all of our jails. Mind you, it's been, in my lifetime, I'm 58. It's been 58 years that Medicaid has been around, give or take, but it's been 58 years that inmates have been excluded from it. So our jails have been set up to fund their medical needs in a specific way, organically grown, and we can't just flip a switch and jump onto Medicaid because we don't have the infrastructure for it. So there's a lot of work behind the scenes, but we are working with Medicaid, we're working with the governor's administration to see what the viability is. If it doesn't happen this time around, we need to get it in the future. It can make a big difference. When we talk about a small jail that might have 8 hours per day of medical coverage, if they can increase their medical coverage and capacity through a Medicaid waiver by boosting up their support and their services, that will improve our jail population across the state. Outcomes for them. Other states have already got on board. California, Montana, Washington, Massachusetts. California was the first. There are other waivers that have been applied. Ohio is not there yet, and that's what we're working towards. But I'm glad to be here with you and at least be talking about these opportunities, because for a long time we didn't have this. We didn't have the opportunity to talk about our jails in a group setting like this, especially how some of these programs have evolved. With support from the governor's office, BSSA has met with Medicaid. We talked about our current staffing approaches. We talked about some of those obstacles that we have to overcome, and we'll see where that plays out here in the next couple months. I'd like to tell you about an opportunity that we're going to put together on November 8th in cooperation with Ohio University. We're going to try to convene for the first time jails and some of our County Commissioners Association and Behavioral Health Authorities and other entities that would like to come. We'd like to invite you to the Dublin campus, and there's a flyer on everybody's table here that's been passed out. A one-day symposium. We're going to try to get on the same page as far as needs and wants. We're going to present some more ideas from local jails throughout the state. And if you'd like to participate, we'd really love to have you there. Registration opens this week. There is a link there that will get you signed up for it. And it's just one more thing to keep the ball rolling for reentry in Ohio. Ohio, I think, is going to lead the way. And it's not a clean process, and it's not a well-beaten process, but change has got to start somewhere, and we're trying to make that happen here. So today we're going to start, and we're going to go a little bit off schedule here. We're going to bring up Franklin County first, but what I'd like to do is I'd like to allow you to hear a little bit about the creative ways that county jails are meeting this population need. These county jails have developed their own programs. Look, know this first. Some of the tenets of prison reentry are cognitive behavioral therapy, our workforce development, our continuing education, our college education, our career development. Some of those things that take a long time aren't necessarily feasible in your jail settings, but that doesn't mean that everything is not feasible. So what we ask of jails is to think about what you can do in your setting instead of what you can't do.
Well, good morning, everyone. Glad to be here with you today. My name is Rochelle Pride, and I have the pleasure of serving as a director for our Franklin County Board of Commissioners Office of Justice Policy and Programs, as well as our court-appointed special advocates of Franklin County. And I will allow my team to introduce themselves before we dive in.
Good morning. My name is Ryan Newsom. I am the Social Service Administrator with the Office of Justice Policy and Programs.
And good morning. I'm Melissa Pearson. I'm the Chief Operating Officer with the same office.
So we're excited to talk to you about our work in reentry as it is one of our largest pillars, our greatest investment in the work that we do for our residents. Just so you have an overview of who we are and kind of what our office does. We are the Criminal Justice Planning Agency to our Franklin County Board of Commissioners and Criminal Justice Planning Board, as well as our county administration for Franklin County, Ohio. Our population is about 1.3 million people and counting. And so we are responsible to effectuate the fiduciary responsibility of allocating federal, state, and local dollars to our justice ecosystem as well as our community partners. We strategically plan, we consult, we offer technical assistance for many projects. If there's something going on related to justice and effectuating it in the proper way, we're probably somewhere involved in the corner in the ceiling. So we're really happy about that, but the biggest piece of it is our work that we are able to do through a lens, first of all, of race, equity, and inclusion, and understanding truly that how you see people is how you serve them. And so it is on us to make sure that our vision remains 2020 in the population that we serve. But we cannot do this work without our collective partnerships and without our system stakeholders. Our sheriff's office, all of our different municipalities within our Franklin County family. In addition to the different sectors, this work would not be possible without that collaborative engagement and impact throughout. And so what we want to be able to talk to you about today is how our work has spearheaded so many different opportunities for us to put individuals in a position where they are able to thrive and not just survive, as our Commissioner Erica Crawley likes to say, because that truly is what the goal of the work that we do is, ensuring that we are putting people ahead of the curve, not at the curve or behind it, but that we're setting them up for success and we're serving the whole person and those family members and other community partners that are connected to them. And so our Rapid Resource Centers are something that has really been a baby of all of ours since inception. Back in 2021, we opened the Rapid Resource Center at our Franklin County Jackson Pike Jail facility. And what we were excited about in being able to do something like that, which we will expound on, is truly the definition of meeting people where they are. A resident can get released out of one door and walk into our door and be able to get everything from a hot cup of coffee to linkage to service. Whatever that looks like, we wanted to make sure that the whole person was being served and that we were addressing all social determinants of health that we know that impact all of us in this room and definitely impacts the people that we serve. Our commissioners have been uberly grateful I might get in trouble because I feel like I keep asking for a lot of money, but as he talked about, we know what investments look like when it comes to jails and reentry. And they have certainly led the charge. They have certainly supported us in addition to our county administration and really creating a model that is now nationally recognized. We all collectively in our respective spaces serve on a lot of different national and state committees to, again, continue to advise, to continue to benchmark, to continue to glean best practices and how we are able to do this each and every day. So when we began the Rapid Resource Center, we were able to carve out a space that my team members will get into a little bit more because they certainly are in the weeds of it each and every day. And I always say that there is no me without this team that we have. We cannot, no one person, no one entity can do this work alone, and we've been blessed to have a team that has been able to forge that. And due to the success of our first Rapid Resource Center, and we'll get into some of the data and the numbers of what that success has looked like, we then began to, as we took a tour, as was mentioned earlier, we have a brand new jail that is online and that we are slowly moving some things into. We have shut down our downtown jail facility. Our downtown jail facility needed to be shut down, so we were grateful for that advancement. And so that left us with the jail that is, again, on Jackson Pike, but as well as our new James A. Carnes Correctional Facility. And so we, of course, are in transition with our residents from one facility to the other. But in the curation of that facility, which is also a state-of-the-art facility that has been nationally recognized, and we've had a lot of people, even internationally, come and tour our jail. The one thing is that we understood that continuity of care is important, and equity and access is also important. So 9 years ago, when that jail was being developed and designed and working with all of the people to make it possible, the Rapid Resource Center was not a thing, and we understood that. And so while we were taking a tour back in 2021 of the new jail facility as it was getting ready to prepare to open, I say that me and Ryan were on a covert mission. I'm blaming him for why I ended up asking for more money again. But it was absolutely necessary to do. As we were walking through the jail, we were looking for a space, a dedicated space, an intentional space, a larger space for another Rapid Resource Center to come online. And so, again, not that they excluded us, it just wasn't something that was in the wheelhouse when it was being developed. But we found a wall that could be knocked out to build out a brand new Rapid Resource Center. And about a year and a half later, and about an additional $3 million plus investment, we were able to bring about a second Rapid Resource Center in operation with our existing Rapid Resource Center. And so with that being said, I know you guys are eager to hear about the what, the when, the how, and the who. And I want to turn it over to Melissa and Ryan to be able to talk to you about some of the data points that we have, what we've seen with our Rapid Resource Centers, lessons learned, and things that we want to organically involve into. Because in reading an article that Melissa actually shared with some of our stakeholders the other day with our Criminal Justice Planning Board, and we also oversee our Reentry Advisory Board, it talked about reentry begins at entry. My perspective is that the best reentry is no entry at all. And so the goal is to how do we eventually move things more upstream, right, to where we can be more preventative, that we can also intervene when we need to, and in the cases where we respond, we do so. So Melissa, with that being said, I'll tee it over to you to talk about our Rapid Resource Centers.
Thank you so much, Director Pride. And thanks everyone for being here today. And a special thank you to Justice Stratton for inviting us. We love to talk about our Rapid Resource Center. We could talk for hours and hours. I promise we will not. We'll give you the highlights, get you a little bit curious about it, and then also invite any of you that want to come take an actual tour, because to see it is to really understand it a little bit better. But let's talk about why we needed a Rapid Resource Center. Well, to do that, I need to give you a little bit of context. What is Franklin County? Well, Andy, we are 1.3 million,
Yes.
14th largest city, Columbus, in the country. We're a lot bigger than people, I think, actually realize. So we needed to be responsive to the population that was coming into our jail. Our jail, average daily population pre-COVID was right around 2,100. Now, we haven't gone back to that number post-COVID, but we're slowly creeping back up. We actually were able to get it down to about 1,350, but now we're actually hovering at that 1,700 mark, and unfortunately, we keep seeing it go up month after month. So Back in 2021, what were we dealing with? Well, we were dealing with a pandemic, so we thought, well, that's the best time to start a new program, right? But we were also we were really embedded in the opioid epidemic, which we all know, we don't even call it an opioid epidemic anymore. We call it an overdose crisis, because why? Fentanyl's in everything now. We needed to be more responsive. I'll tell you, I heard a sheriff out of Middlesex, Massachusetts say this, and it's stuck with me ever since. He said, Melissa, vision without data is just a hallucination. And I thought, God, that makes sense.
It does.
And so we knew we needed to really prove our point. Why? Because we needed to get some space in the jail. And the Jackson Pike jail, if you've ever been there is no space. Space is at such a premium, hence why we have a brand new jail online. But at that time, we didn't have that option. And every little corner of that jail was being used for something. We needed a space to be able to do some additional programming. And so I want to start with a data study we did very early on. And one thing I really recommend, and I'm going to stand up if you don't mind. One thing we did very early on was to prove a point that we already all knew in our guts. We all knew we were working with the justice-involved population, and they were some of the most at risk for overdose and death. We all knew that, you all know that sitting in this room, but we didn't necessarily have the data. We had national proxy data, but in Franklin County, we like local data. We like state data. So what we did is we reached out to our coroner's office, and we actually did this first study in 2017. We've done it every other year since. So in 2017, what you're seeing up here is the 2021 data, but in 2017 data, we asked the coroner for every single overdose death that happened in Franklin County. We were provided that data. We took that data and overlaid it with our jail management system. And you know what we found is exactly what our guts told us. We are working with, in fact, the most at-risk population. In fact, in 2017, close to 25% of the individuals that died in 2017 were in our jail the 12 months preceding. I'm going to say that again because I really want you to let that sink in. In 2017, every single overdose death in Franklin County, 1 out of every 4 of those individuals that died were in our jail the 12 months preceding their death. We took that data and we extrapolated it as many ways as we could. I could tell you how many were in our jail six months prior to their death, 4 weeks prior to their death, but I'm just beating that drum. The point is this: we know we're working with the most at-risk population, and this data confirmed it. Why is that important? Again, we need to talk about actual data to prove the worth and the merit for why we need some of these programs. Here's another data nugget for you. In 1999, if you were to look at our jail population, what you would see is that 90% of the individuals in our jail were misdemeanors on pretrial charges. Well, we've done a really good job at flipping that script. We've done exactly what we knew we needed to do. If you look at our jail profile today, it's 90% felony pretrial. We have very few misdemeanors in our jail today. And that's a good thing, right? We got the people that we're mad at out of the jail. We've kept the people we're scared of in our jail, and that's who sits in our jail today. The problem, though, is 70% of the individuals that get booked into our jail are out within 3 days. So how do you take that data and marry it up with the fact that we know we're working with the most at-risk population? How do we use that window of opportunity while they are in our jail? Because that's how we see it. It's an opportunity. But in 72 hours, we're not miracle workers. So what we had to do is figure out another way. We had to jump outside of that box we're used to working in. So we went to Chief Stobart, we went to the sheriff, and we said, we need to get our arms around these individuals that are processing in and out so quickly that we cannot offer the services that we know many do want and so many could benefit from. So what did? We walked around that jail. We walked around that jail and we said, give us a closet if you have it. Because what we wanted to do was create an exit through the gift shop model where individuals, as they were being released, were walking by this beautiful room, and that's all it is over at Jackson Pike. It's just a room, and it really was used as a closet. They really, that when dry cleaning came in, guess where it went? It went to this room. We said, give it to us. Let us have it. It's in the non-secured part of the facility. So as individuals are released, now it's not quite an exit through the gift shop like the one at the new jail is, but it's there. So when individuals are released, they know they can go to this room, they can get anything from a cup of coffee all the way to get linked to treatment. And Ryan will go into those actual services here in a minute. We wanted to make it easy for people. We wanted to transport people to their next best location. We're not located on a bus line. And from talking to jails across the state, there's a lot of other jails that are in the same boat. They're not located on a bus line. So we knew we needed to figure out, well, how do we get people to their next best location safely? And we'll talk about that a little bit too. So the Rapid Resource Center really was intended to be a fast track into treatment, but then there's all these other needs that we know individuals have. And our Deputy County Administrator, Joy Bivens, likes to say this. She really likes sandwiches, and she always talks about peanut butter and jelly sandwiches. And she says, I don't go to Kroger for my peanut butter, and then fly over to Giant Eagle for my jelly, and then go off to Aldi for my bread. We don't do that. And the people we work with shouldn't be expected to crisscross the county for all these services we know that they need. We want to set people up for success. No matter what your philosophy is, we want to set people up for success. We don't want them back in the jail. We don't want them going further into the criminal justice system. We also know people with a mental health diagnosis, they come back to us more frequently and they stay a lot longer. So what can we do a little bit differently to make sure we're linking people as soon as they get out of the jail to services? Now I'll tell you this. Not everybody takes us up on our offer, but we plant a heck of a lot of seeds. And I really am very confident that we are making a difference. So now that I've whet your palate, I want you to hear a little bit more from the guy himself who actually is putting these programs into place in both of our jail settings. Brian? And you can click forward maybe one.
Yes. Good morning again. My name is Ryan Newsom, Social Service Administrator. I just want to talk a little bit about our operations of the Rapid Resource Center. You have the visual services as well as some stats. So again, we're located at the Jackson Pike Jail. That's our first location. Our second location is at the new James A. Carn location of the new jail. In 2021, we started at Jackson Pike. We started out at just one shift. We started day shift, 8 to 5. We realized that that wasn't enough. Like the sheriff officer would tell us, they released 24/7. So notwithstanding the funding that wasn't available, we want to reach out and try to extend our hours. So currently, happily to say that we are actually 24 hours a day, 6 days a week. So that means that anyone who's being released during those 6 days, and I'll get to the 7th day in a minute, can stop into the Resource Center and pick up the services that Melissa and Director Pryor talked about. On the Sunday, which is the 7th day, the data doesn't support being open 24 hours a day, but it does allow us to be open at least 8 to 5 to provide those services. So I'm going to kind of talk about also the makeup of the Rapid Resource Center. So we do have county staff members there for those hours. We also have partner agency staff, and they're definitely looking to increase their presence in the Rapid Resource Center once we get to the new space, because like Melissa talked about, the space at Jackson Pike is kind of a closet, but it's functional. It's a functional closet. The most important thing we want to do is have a space that individuals can come in and receive services. Another thing that we kind of want to focus on is the location. What I mean by that is the location where people are being released compared to our location with the Rapid Resource Center. I'll talk a little bit more about that when we get to the new jail. As you can see, a new Rapid Resource Center at the new jail, which is more of the model that we wanted to do as far as the gift shop model. So services. So as you can see, we in about a year's time, we had 9,469 walk-ins. Very impressive. I will admit the hard linkages to care. 143. I would love to see that number in the thousands. And I'll talk about our future plans to increase those linkages. I'll talk about that as well. And then, of course, the in-reach visits and soft linkages. You can see those numbers. Well, one thing I would like to mention is with the Rapid Resource Center, we didn't just want it available to those being released from incarceration. We wanted family members to actually be able to stop in and talk about resources and services for loved ones. So that's one of the services we offer for family members to come in, provide information for their loved ones. Our staff will go inside the jail and talk to those loved ones as well. And I'll talk a little bit more about our InReach program as I go over the data. You can see service support, hygiene. You can see the major services, bus passes and ride-share transport. Again, Melissa mentioned that our jails are not on the bus line, so that's a major request to get individuals. Well, another thing I like to notice too, there's a small window when a person gets released. They really don't want to stick around, okay? So we got a small window to try to talk to them, encourage them about resources, life-changing decisions as they go out the door. Our current Jackson Pike location is not conducive to that because of the way it was, again, it was a closet that we kind of created to help us, but the new jail, we actually have meeting rooms and places like that where we can actually sit down with an individual. So again, so you can see those services. The ride share is most important. We do, like I say, we're open 24 hours, 6 days a week, so there are third shifts. Just to make some clarity, we don't just transport anybody anywhere. We mostly use cab services. We want to make sure a person is going to a legal and safe location during the transport. So that's very important. So staff really, they'll do diligent work to make sure that's happening. Even if it's making a phone call, looking into the jail management system to make sure that individual didn't have a domestic violence charge or any type of restriction. So that's very important. Hygiene is also important. There's a high number of that, and again, IDs, birth certificates, all those things that helps a person transition back into the communities effectively. Let's see, coffees and snacks, you can see why people stop by. That's kind of our care. We want to bring a person in, but it's a need. You know, of course, I'm sure a lot of you haven't been in jail, but coming from jail, you want some water or some fresh water or something decent to eat. They'll come in and they'll grab that. No knock on the sheriff's office or anything like that. So we know we can provide. So we get a lot of people in to use want snacks and also phone, charge the phone, use the phone, get in contact with loved ones, request for someone to come pick them up. And again, third shift is not those transportation opportunities we provide prevents them from having to wake up a loved one if they're released 3 or 4 o'clock in the morning. Which some people, family members might not have that opportunity to pick up their loved ones. To use computers in case someone wants to do a JFS application or a job application, something like that. So I don't see our JFS, but that's one of our major things. We want to make sure everyone leaving the jail have access to food stamps if they need it, SNAP benefits, as well as most important, insurance. So if they want to get linked to treatment, if they want to get mental health treatment as well as substance treatment. That's really about it, because like I say, you do have the visual of currently what we're doing, the service provided. Our future goal of the Resource Center is to increase those linkages to services, mental health, as well as substance treatment. And so what we want to do is start increasing our InReach. So our InReach looks like this. Did you have a question? Oh, yeah, go ahead. Probation? We do work with a probation officer, but only in the capacity as where they actually come to the facility to connect folks to like house arrests and things like that. We do receive calls from probation to actually go in, as well as parole officers, as well as social. Is that what you're looking at? You're kind of getting to. So yeah, we do have outside agencies actually call us to ask us, can we go in and visit with a client of theirs to talk about resources and stuff before they're released. So yes, we do have that relationship. Oh, I'm sorry. Yes, sir.
You're being interrupted. You probably, well, maybe you can, but there are some folks here that probably can. Why do we release inmates at 3 a.m.?
You know what? You went there. I was
question.
coming back around to that, sir. Thank you so much. As long as we still, for some reason, think that's okay to do, we wanted to provide the service, but from a policy and procedure perspective, that is something that we're working with our system stakeholders, i.e. the sheriff's office and other entities, to figure out how we mitigate and eliminate that. We understand that there's nothing good for an individual coming out of jail that would happen after hours that we would want them to even be potentially exposed to or be involved in. And so because this is something that has just been the practice, right, we want to be able to drive some type of policy and process change down the road, and we're hoping that that can happen much sooner rather than later, to again, interrupt things that could potentially go wrong for an individual at that time of night.
Looks like Andy wants to weigh in over there.
In the jail environment, you have to be cognizant that this is a 24/7 operation. Let's say somebody's brother, sister, mother, mom, dad got into an argument at the holiday Christmas gathering, and they ended up getting arrested and going to jail. All right, if their bond is posted at 3 a.m., they want out of jail at 3 a.m. We're going to let them out of jail. If they have a lawful order that says they can be released, then we're going to release them. Those don't happen all the time. The majority of the releases happen during court hours or shortly after court hours. But there are some that happen all through the night. And if you have a loved one who's in that jail, you want them to be able to get released as soon as possible. Whether that's 1 o'clock in the morning and you have to arrange for transportation, or whether it's 9 a.m. and it's a lot better to get something. So we are jails, we are full service, we are 24/7. We can't schedule our release dates very cleanly, and so we have to be ready for that. But that's what makes Rapid Resource such a valuable tool. If they can get their hours expanded and have somebody there to address those needs in the middle of the night. And that's just a capacity issue.
Yeah, so we currently, as said earlier, we do have someone there awaiting them. We're there 24 hours a day, 6 days a week. I think another component to that we have talked to with our prosecutor's office and other entities in the weeds of it is what does it look like for an individual who may be indicating homelessness coming into our jails, which we know happens quite often, right? More often than we would like to acknowledge. And the reality of it is that what does it look like? Some of the conversations that have been had is, what does it look like to have a document to where this person, from a legal perspective, if they're saying or waiving their right to be released at a certain time because of what they don't have available at 3 in the morning versus what's available at 8 in the morning. And so as stated, the jails have a responsibility to release upon the time that those release documents come. But if an individual is given who is sound and who is able to articulate what their need may be, these are just some of the process and policy conversations that are happening, is making sure that we're not, of course, impending upon somebody's right to be released, but what does it look like if that's something that may not be a choice they want to take at that time? So it's a heavy discussion and has been one in our county for quite some time of how can we address that.
All right, so back to, and again, the wonderful part about the Resource Center, again, is the team. The 3 shifts, the undetermined release numbers, so it takes a team of individuals to really sit and work those shifts, really serve those individuals, figure out what happens with the person who gets out at 3 a.m., but they're have no resource or have no family, what to do with it. So I always want to give kudos to our staff to make that work. So kind of going back to InReach. I'm sorry.
And the type of team, well, just so you know, as he's talking about the team, we do utilize heavily our peer support model, which we know is a proven concept across the nation and working with the population that we serve. So our peer supporters, our reentry navigators are a huge pillar of the work that Ryan mentioned as far as just that day-to-day and walking with that person post-release.
Correct. Okay, so I just want to talk about InReach, and I'll turn it back over to Melissa. So our InReach efforts, again, we want to market, kind of advertise Resource Center, to allow individuals to know the resources that are available. So one thing's, again, the collaboration with the Sheriff's Office, the support we receive from them is unmeasurable. This wouldn't be possible to the effort that we present to the population if it wasn't for the Sheriff's Office. Because we do have Sheriff Office staff members who actually send people our way. They will call and say, can we come back and see someone? Part of our InReach is sending our staff back into the jails to meet with individuals one-on-one in their professional visit rooms. So that takes, it takes time, it takes space, it takes effort from their staff. So we always want to thank the Sheriff's Office for that. But part of our InReach is we send letters. Everyone that's booked, I run a report each week. 3 times a week to find out how many individuals was incarcerated. We send them letters, letting them know that there's resources available. They can also call us at the Resource Center. We have 2 lines. They can call for free to the Resource Center and request resources or ask for someone to come see them as well. Part of the future, what we want to do is start going back in, doing a little bit more transitional planning, discharge planning, as well as treatment planning, and then bring in those community resources, link those with community resources so maybe they can come in and see. Like we said, we all talked about the amount of hours individuals there at the jail, the higher percentage of those individuals. So we got to move fast. And again, that's going to take a major collaboration between the sheriff's office and our staff members to get that accomplished. But that's one of the major things we want to do. The new resource centers you see there, there's meeting rooms, there's places where individuals can actually come in, breathe, and maybe have a sit down with the individual and get them linked to service. And we want to definitely offer more of our community partner agencies, just mentioning Primary One Health, Columbus Public Health, Franklin County Public Health, we had Southeast. We have all these individuals in the beginning at the resource center. They're not there yet because the space is not very conducive. The releasing schedule is not very conducive, but at the new resource center, we hope to bring a lot of them back for those services, to provide those services to the individuals. So no more questions about that. I'll turn it back over to Melissa.
So I think you heard from both of our team members, all three of us, relationships are what matter. We don't believe programs change people. We believe relationships change people. And so one of the things that I can tell you, a lot of people ask is, well, why do you think this program works? It's because of the people. It's because of the peers we bring in. It's because of the passion we require. If you don't believe people can change, you don't belong working with our office. And it's just as simple as that. You can have $1 million program, but if you don't hire the right people, you're not gonna have results.
Absolutely.
You can have a shoestring budget and hire the right people, which I think we've done.
Absolutely.
And you can have some really remarkable results. So I want to emphasize that. But something we learned very, very quickly, and you guys have all heard this, our jails are de facto mental health hospitals. Who hasn't heard that? But here's another reality. They're also our largest detox facilities, and oh, by the way, the biggest homeless shelters in our county. We can't forget those other things that are going on in addition to the mental health stuff. So we realized really quickly that, hey, if you don't have a place to put somebody so they can stop and think for a couple days about what their next steps are, you're not going to get very far. We all know about social determinants of health, and we've got to make sure people feel safe, fed, and warm before we can even ask them to think about long-term treatment, getting a job, going back to school, getting their kids back. So what we did was we realized about 20% of the individuals booked into our jail book in as homeless. They are from the streets of Columbus. And we know that if they get released back to the streets of Columbus, the odds of them staying out of our jail, staying out of our hospitals, and staying out of our shelter system is very, very slim. So what we did is we created a respite program. It's called the Bridge Program. It's not long-term. It's not going to solve affordable housing crisis. And it's really a very short-term intervention. But if you come into our jail and you're booked in as homeless and you get released anytime after about 2 p.m. in the afternoon, we know it's really hard to access services. So what we offer is an individual can be transported to our Bridge Program. And it literally is a bridge. It's a bridge to where's that person going to go next. There's no requirements. They don't have to go to treatment. It happens to be at a treatment facility, so if you want to leave this wing of the program and jump over to the other wing, oh, you're automatically in residential treatment. So that is a little bit of a perk, but you don't have to do that. So you can go to the Bridge Program for 5 nights and just simply be safe, fed, and warm. And while you're there, the only thing we ask that you do is work with our peer support specialist that is there on site for a transition plan. We want you to be thinking about what's next steps. It's amazing when you're feeling safe, fed, and warm that you may think of that relative that you hadn't thought of, maybe in Indiana. Well, they have a spare bedroom. Maybe you could go there and stay with them. So all we ask is that they begin having those thoughts. One more little tidbit for you, because I told you I love data. We did an overlay, or we did a data match with the Community Shelter Board. We didn't think 5 nights was going to have a profound effect on homelessness. That's not enough time. But we thought, oh, let's take a look at it. So we asked the Community Shelter Board to look at the 130 people that had received our respite program to see what the impact was. I couldn't believe it. Only 20% of those 130 people ended up in our homeless shelter system the 6 months after that 5-night intervention. Again, we're not solving affordable crisis in our homelessness situation, but I do think there's something there. So we're going to keep studying it to find out. But let me have Ryan talk to you a little bit more about what they do when individuals get transferred over to the respite program.
You have another slide now. So again, as Melissa mentioned, we have staff on site, and the part of the agency as well will step in on the second and third shift and as well as the weekend. So what we want individuals to do, if they're deemed homeless upon release, we want to get them there, again, to give them the opportunity to make that decision, that life-changing decision in a slower time. We don't want them to make a quick, let me just call a friend I know that helped me get in here to come and get me. So we want to take them there. Staff member is there during the day. We just kind of notify the facility that these individuals are on their way. They're provided 3 meals a day, 3 hot meals a day. They have shower, of course, linen. There's phone there. There's TVs in the room where they can sit and watch TV. There's a computer they can have access to as well to try to find or linkages or resources. But it's really come on our staff to make those linkages and connections for them. The stat that Melissa talked about, that only 20% of those individuals ended back in the shelter, is really a testament of the work that our staff does, and the indicator of those 5 days of really sitting down and with staff members and talking about intervention and linkages, how that helps. Sometimes it's a requirement that individuals go over 5 days. We try not to for that. We try to keep that from happening, but it does happen for good reasons. We hope that an individual, maybe their Medicaid is not in place or there's not available space to a certain treatment facility that they want to go to or something like that is the only reason. At no time is someone just sitting around 5 days. A lot of requirements is that they have to work with staff. If they're not making themselves available to staff, then unfortunately we have to try to find a different means of housing for those individuals. We request that they don't leave before they see staff the next day. There is a curfew there, and there, of course, with the other, just like most facilities, they're subject to urine test, urinalysis, as well as searches and of their materials as they come back into the facility. And again, that's for the safety of the others there, as well as the facility, the treatment facility right beside it. That's pretty much all for the Bridge program. Like I said, we was very excited. One thing, again, how that came about is we thought, okay, we're open 24 hours a day. Person gets out at 3 o'clock, they have no place to go. A lot of the community agencies are not open to 8 or 9 o'clock or even over the weekends. Now what we're gonna do with this person. So it didn't do us, it didn't serve justice to those individuals for us to be open. It was helpful, but we still had nothing to do with them. So being able to provide them a safe place to go, shower, cleaned up, have a place to, food and everything like that to their, to their access and all that was very helpful. So.
Is this for men and women?
Men and women, yes.
What about sex offenders?
Sex offenders, we do not discriminate. We do, again, that's not, the location of the facility is welcoming to those with those charges, so we don't have a problem with that. Again, so those 5 days, is we have served sex offenders there. We will make note of that, and then we'll work diligently to try to get them out of there. Yes, ma'am.
How is Bridge funding?
So all these programs that we're talking to you about, we seed with federal grants. We use the Justice Assistance Grant Program. We use COSAP. We use, what are some of the other big ones? We write for everything. And that way, when we get the data and we prove the concept, then we go to the Board of Commissioners, who have been extremely supportive, as Director Pride has been, to really understand that we can't keep this funded with grants forever. A lot of our programs, like the Rapid Resource Center, I'd say the new one, about 80% of it will be funded with general funds. So we're pretty excited about that. We believe this program eventually, it's proving its merit. And this is actually OCJS, I just saw Lisa, this is funded through our RSAT grant. So that's another one to think about. And I think it's important for us to now do a little plug for our state partners. Not only has OCJS been extremely supportive of these programs, but other programs too that we'd love to come back and talk to you about. But OMAS, wow, between the LAI and the MAT reimbursement to the jails, that's a game changer. And when I hear there's still money left over each year, it blows my mind. So if you're not taking advantage of that reimbursement and you're a county sheriff's office, you really need to look into that, because it's a game changer, quite frankly. It's a game changer. We used to limit our MAT to 1 injection at release, but because of this funding, we now are able to give individuals multiple injections, monthly injections, and it's paying off in terms of their cravings obviously are coming down, the level of fights, overdoses, all the things that come along with people who are detoxing in a jail.
Right.
has all been reduced. We'll be studying that too to tell you, exactly what we're seeing. But OMAS, thank you for thinking outside the box. And with your latest landlord mitigation program,
Yes.
that's been amazing too.
Yes.
So
and I
thank
will say,
you.
in addition to that, I believe last year was the first year that we were actually seeded with some general fund dollars because of the proof of concept that we've been able to do with many of our programs that, again, initially seeded by grants. Once that concept was proven, again, our commissioners and county administration has been uber supportive in that way. And then they made the mistake of also making me interim director of economic development and planning right now. So I'm going to find other dollars and other buckets of funding, right?
Amen.
That can transfer over because it is eligible under certain community development block grants and home funding and the world of HUD. So we're always looking, we're always attempting to make sure that, again, we're putting our best foot forward and getting those grant dollars. We have an amazing grants management team that Melissa oversees, and that work has been huge in just us being able to get the buy-in and the other resources for funding these initiatives.
Franklin County is huge, and they are wonderful, and they've got a unique program. They have their Office of Justice programs. They are not tied in with the sheriff's office specifically. In Lorain County, our rapid reentry is within the jail and is sheriff's office employees, and Montgomery County is the same way. Butler County is the same way. What you're going to see is that there's lots of different ways to do this because we are all so different. With the state of Ohio, the DRC, it goes through one chain, through the director, and then down through the system, everybody marches to the same drum leader, band leader. In sheriff's offices, there's 88 elected sheriffs in Ohio. There's 76 full-service jails in Ohio. Everybody does things a little bit differently. The funding streams are not the same. We don't all have grant writers. We don't have this or that. But what you'll hear if you stick around is there are unique ways to overcome those obstacles, and we've done so. There's many different ways that reentry in jails can be run, and each has evolved individually because there is no one set established way to do it. It's not well researched, it's not well funded, it's not well documented. So many jails, many sheriff's offices have tried to do these things creatively. We must understand that most of the things that we're talking about are not within revised code as necessary requirements for the jail. Jails operate along jail standards, revised codes that dictate what we have to do, when we have to do them, how we have to do that. We're talking about photographing, fingerprinting, booking, showering, changing, meal service, linen changes, restroom access, square footage, lighting, water temperatures, all of those things, visitation. Those are all dictated in Ohio Revised Code. There's nothing in Ohio Revised Code about jail reentry. As I said before, this is new and this is growing, and it needs to grow and it needs to get funded and researched. But we just heard from Franklin County, who is the largest. Franklin County, by the way, books 23,000 people per year. Only 14,000 people went to prison last year in Ohio. 23,000 got booked through the Franklin County Jail. As a matter of fact, Franklin, Cuyahoga, and Hamilton counties routinely book more people every year than the number of people that we send to the prison system in Ohio. And the 10 largest counties in Ohio, including down to Lorain, process more females on an annual basis than the Ohio prison system does. So if you're talking about need and impacting communities, we're talking about jail reentry. Let's not wait until someone is a convicted felon before we try to offer intervention services, connections in their lives. We've got Montgomery County is represented this morning by Teresa Russell. I've known Teresa for a few years. She really does some hard work, and she's about to tell you about how their program evolved and what they do. Thank you, Teresa.
Sure. I'm Teresa. I am the Director of Criminal Justice and Outreach Services in Montgomery County. I work for Sheriff Rob Streck. I actually came to Montgomery County in 2017 under the former sheriff, who is now a state representative, at the height of the opioid epidemic. And I was tasked with one thing coming in the door, and that was developing MAT, right? So again, we're sitting here today in 2024, everybody's had this experience. Sure. Had this experience with, the people who are coming into the jails, coming in, you detox them, then they walk right back out and face overdose if you don't have wraparound services. So I could not come in and develop MAT services without having planning around reentry. So I want to talk for a minute about statistics, and I pulled this off the SAMHSA website last night. It looks like there's an estimated 44% of individuals incarcerated in county jails have mental illness. That pretty much matches the population in my jail of people getting psychotropic medications every day, right? So on top of that, we estimate that 63% of those people in jails, 58% in prisons have a substance use disorder, right? So again, I came in 2017 looking at a very specialized population of people. But reentry is important for everybody. Everybody needs reentry services. So we're going to talk about exactly how we develop that in Montgomery County. But for Montgomery County, this was huge. And these statistics were important because clearly Montgomery County, unfortunately, was known as ground zero for a national opioid epidemic, right? In 2017, we had the most deaths per capita. This is why it was super important for my sheriff to say, I need somebody behind the walls that's willing to do Vivitrol, right? I need somebody who's willing to do education and all of these wraparound services. And we had tons and tons of community providers that said, we want to do it, but oh my gosh, we can't get paid for it inside the jail, right? So how are we going to do that? We looked at reentry services with 3 legs: a formal discharge planning service, peer recovery services, and how to enhance community partnerships. And a lot of this is going to sound repetitive to what Franklin County just stood up here and talked about. But discharge planning was key. Coming in the door, my thought was, discharge planning for somebody incarcerated should look like a discharge plan for you and I leaving a hospital, right? It should say, why were you here? What medications were you on? What's your next appointment? Where do you go? What's your insurance status? All of those good things should be included in discharge planning. So let's talk about discharge planners. I lobbied, I said, this has to be robust. So I went to my sheriff, who then went to our county commissioners, who said, we want to basically wrap the idea of having discharge planners into our correctional health care contract. So we asked for 3 full-time discharge planners. At the time, pre-COVID, even though Montgomery County has a population half the size of Franklin, we were booking in between 23 and 25,000 people a year. I can tell you right now, 3 full-time discharge planners are not enough. 3 full-time discharge planners are still not enough for the 17,000 people we're processing post-COVID. That's why having community partners are important, and peer support. I'm going to hammer while I'm standing up here on peer support services. Ohio's ahead of the game.
Yeah.
But we really are. When it comes to peer services, I got to present at the National Sheriff's Association last fall and went in strictly talking about peer recovery programming in jails. And all of these sheriffs were like, no way. There is no way I'm giving somebody with a felony background and in recovery keys to my facility. And I had sheriffs walking up to me afterwards saying, oh my gosh, I'm a believer. And thank goodness for sheriffs like Sheriff Katusian from Middlesex, right? Because he'll stand up there and tell you, you have to have these navigators. You have to have these people who have lived experience that get up and help. For me, coming in 2017 saying, hey, I want to develop MAT services in this jail, I don't have any lived experience. I can walk through that jail every single day. I have no credibility. I'm seen as a figure of authority. My sheriff comes in, he walks every Friday. The inmates will talk to him, but not about their needs, right? But they will talk to people who have been where they are. So those peer recovery specialists are key. And again, I'll come back to them. But discharge planners. So I wanted a full discharge plan, something that was completely comprehensive, that identified everything that somebody needed. How does someone get a discharge plan? Was it only solely for somebody who had MAT? No, because it needs to be available for everyone. So we developed a system where a discharge planner, you could get discharge planning services one of 3 ways in the Montgomery County Jail. you could ask for it. You could put in a kiosk request and say, I would like to meet with the discharge planner. We advertise through our kiosk system. We advertise through our jail TV system about discharge planning. We see discharge planners walking through, inmates. We have what I call inmate.com. They'll say, who is that? What do they do there? They'll ask their other people in their housing unit. They'll ask the corrections officers. That's a discharge planner. They'll say, I want a discharge plan. So the discharge planner will come and see them within 24 hours, right? The second is a court request. When discharge planners got ramped up in 2018 and probation officers learned we had discharge planners, they thought, ooh, this is gonna help me a ton. And it does help them, and it also kind of keeps them from, an inmate saying, I need discharge planning, and getting something set up, and then the court turn around and setting up something totally different, right? So they do communicate with probation and parole officers. But more importantly, one of the things that we said was, these people come and rotate in and out so fast. We are now at 82% of our population are felony offenders. They're still out of that jail, and average length of stay for them is still 6 days. 3 days for misdemeanors, right? So again, people are coming and going really, really quickly. So what happens is every Monday, my population manager sends out a list of people who have been sentenced to the Montgomery County Jail. And if you're within the last 30 days of your sentence, a discharge planner is going to come and see you regardless. So they're going to come up and they're going to say, hey, where are you going when you leave here? And if an inmate says, I don't need anything, I'm good. Like, I've got all my needs are covered. They come up there ready to talk anyway. They come in and they say, well, I've run your insurance status and it's not active, right? So we can do an application for you today. At least you can leave with an application number. Where are you going to live when you leave? When you came in, you had to detox. These were the substances that you were dirty for. Who's going to continue your blood pressure medication? So they engage them in conversation based on what they know. And because they're part of that correctional healthcare vendor, they have access to the entire electronic medical record, right? So they're looking at those things before they go and see someone. If they still refuse discharge and planning services, they've refused them. That's okay, and that's their right. But it was at least offered. So one of 3 ways, that's it. There is some special consideration given to inmates who are high utilizers of service. We'll come back to that also because we have a couple of initiatives in Montgomery County that help us identify what we call familiar faces. So those familiar faces kind of get fast-tracked to discharge planners to let them know, here's somebody in custody who is utilizing a lot of services in the community, especially the hospital systems, the homeless shelters, things like that. Discharge planning is not done by peer supporters. They're actually done by what I call case managers. So our discharge planners are skilled case managers. They usually come from behavioral health care backgrounds. They understand the community programs that are out there. But we are huge utilizers and supporters of peer support. Again, these are the people who have lived experience. If I walk through that jail and I walk up to an inmate and say, what is it that you need when you leave? They don't want to tell me. Sometimes they will, but it won't be as in-depth as it is for somebody who's already in recovery. Peer support fields a lot of those referrals to discharge planners. So we do not ask peer supporters in our jail to be case managers. We want them there just to be somebody with lived experience who understands what they've gone through and can help them kind of navigate, but not actually do the case management work. Let the case managers, let your discharge planners stay in their lane, and let peer supporters be those cheerleaders for those people. Just like you wouldn't want a peer recovery person trying to offer legal advice, right? So you don't want them being part of the discharge planning process in regards to helping set that up. But they can definitely make that referral. I mean, they're usually the first point of contact when they're talking to inmates to say, have you talked to a discharge planner? You can put that referral in through the kiosk, or I can help you do that. Discharge planners also come and meet with everybody regardless of what their stage of change is, right? It's kind of like peer support. Super frustrating. One of the things that our discharge planners get the most frustrated with was, Bobby, we just did a discharge plan on you, 30 days ago, and you're already back in jail on a probation violation, right? It's that stage of change. And until we brought peer support into the jail, working with discharge planners, did the discharge planners really get that, oh, sometimes we're setting up these services for people who really aren't in a stage of change, right? They might be pre-contemplating where they need to be. So they've been a good support for each other, I think professionally, peer support with discharge planning. But either which way, they are two very distinct but very important supports for your inmates. Again, 3 discharge planners, 2 peer support specialists assigned into Montgomery County Jail. Nowhere near enough for thousands of people who are coming in every single year. So what we did was we set up MOUs with various agencies to help us follow up with people upon release. Again, this went all the way back to starting with the people who signed up to be part of MAT programming. So I wanted to know that this was helping, right? So in the first 2 years of starting Vivitrol release program, I was like, how do I track recidivism? How do I track if this is working? Like if discharge planning helped, if they followed through with MAT. So I very, very, very heavily depended on some of the outreach agencies in our community to do follow-up with those people. So literally, if a discharge planner set up an appointment for somebody to follow up at a community behavioral health agency and they didn't show up, we didn't have the manpower through the sheriff's office to go knock on doors. But there were tons of agencies that had grants and other peer supporters and community outreach specialists that did. They went and knocked on doors and said, hey, you didn't make it to your appointment. You said you didn't need transportation when you left the jail. What's going on? Let me help you get you set back up. They come to the jail. They pick those people up now. They take them. So we're not using as many of our deputies for courtesy rides anymore like we were. We have 5 agencies now that we work with through MOU at no cost to us. And that's probably one of the greatest benefits when you look at how to fund services. A lot of nonprofit agencies are going to get grants before the sheriff's office does, unfortunately, right? But they're going to get opportunities for those grants and they're going to want to partner with you. They love to partner. They call me all the time. What do you need? I need outreach. I need somebody to go and follow up on 17,000 people this year. And at first they go, ooh, I don't know. But it sounds good and it's going to look good on paper and I'm going to apply for it and let's see how it works, right? And they do. They really, really do. Again, probation and parole. One of the initiatives that we have through our sheriff's office is called GROW, Get Recovery Options Working. GROW started with a woman in Montgomery County who her daughter was frequently overdosing, and she started Families of Addicts, FOA, which has branched across the state of Ohio and to other areas. But she was constantly calling because she wasn't sure who to call for help, but she would call the sheriffs. We would go out and work with her. And when her daughter got into recovery, she became a certified peer recovery specialist. And through GROW, we have a peer supporter who every once in a while will go out with a deputy and treatment provider, and they'll go and do overdose follow-ups, right? This is part of our diversion tactics. Like we want to keep people from coming into the jail. Little sidebar from reentry services. But this kind of grew some momentum with probation and parole. Probation and parole took the model for GROW and said, hey, not only just following up on your people who have had overdoses, but some of our offenders who just got put on probation and parole. Like, will you go out and check on them and see how they're doing? Because if we show up with probation and parole on our back, they're not opening the door for us. Sometimes they don't open the door when they see the deputy. But when they see that peer supporter, they open the door, right? So that's been great because that's been another part of that community partnership where we can go out with our outreach teams and say, hey, you had a probation appointment on Tuesday and you missed it. Are you doing okay? Like, what do you need? What's happening? We don't want you to come back through the jail, right? And our public defender's office. About 3 years ago, the public defender's office got a grant. They started what's called a holistic defense team. Those are complete wraparound services for our people in and out of the jail. They put, again, some special emphasis on our people with significant mental health issues, especially our people who end up going to Summit for competency restoration. They follow what goes on in the jail. They're part of that discharge planning team. If they have to go down to the state hospital, they're part of the treatment team planning there. And they are the people who actually hold those offenders' hands through processes, right? So when we have our population of people who have significant mental health issues, that was one of my biggest pet peeves coming through the door. I worked in community behavioral health for 25 years before I went to the sheriff's office. I spent 4 years working at Twin Valley. I was there when the doors closed. I knew you can do a discharge plan for somebody with a significant or with a severe and persistent mental illness. You can give it to them all day long. If you do not hold their hand through the process, they are not going to go. They are not going to show up. They're not going to follow up. We have a lot of frustration on law enforcement is frustrated all the time when we take people to local hospital. Do a pink slip, they're back out on the street. I call the hospital and say, what happened? Well, we discharged them to follow up with services at A, B, and C. But you put them in a cab and sent them home, right? Well, they knew where they needed to go. Okay, so, but unless somebody is actually there to hold their hand through those processes, that is what our holistic defense team through the Montgomery County Public Defender's Office does. They literally hold someone's hand through the process. I had a call last night at 7:30 last night from one of the social workers with the holistic defense team. Said we had a judge in Montgomery County who was revoking conditional release on a defendant who now lives in Kentucky. And he has 10 days to turn himself in. The family was scrambling. They were trying to get him up to Montgomery County Jail last night. He has a slew of medical issues, onset of dementia, some other problems. But this woman, who is the social worker, is working with the family to make those arrangements to get him here and then get him tucked away at the state hospital where he's supposed to be. Again, these are things that are outside the scope of roles and responsibilities of a jail discharge planner, but jail discharge planning is so dependent on that information and those partnerships with probation, parole, our peer supporters, and now this holistic defense team of social workers who work with the Public Defender's Office. ADAMS board, or some of us call it the ADAMS H board, right? We run 2 separate roundtables in our county that supports reentry. Through ADAMS, we do what's called familiar faces. Again, familiar faces is our people who are, they're high utilizers of service. They're in and out of local hospital. They are in and out of your local treatment facilities. They are in and out of the jail, right? So this is the chance for everybody to come to the table once a month and staff who those familiar faces are and what services do these people need, again, as a diversion effort to keep them from coming back into the jail, to keep them from going back into the hospital, and just make sure everybody's on the same page with what was the discharge plan for somebody who left the jail. So again, you want that information shared. We share our discharge plans with the court. We share our discharge plans with our local ADAMS H board, with all of those providers who sit in those roundtables. And then our Montgomery County roundtable is a monthly team meeting. That is heavy with law enforcement. So in Montgomery County, we have 28 arresting agencies. So we bring pretty much a little bit of everybody to the table because a lot of our people are transient, right? They're going in between the districts. They're going in between the townships. Everybody's working with the same people. And again, this kind of keeps everybody on the same page. So when those familiar faces hit the jail, discharge planners know, all right, this is somebody who's already linked to this behavioral health agency. This is somebody that the homeless shelter or the homeless system has already been working with. One of the points that Ryan brought up was how important ODJFS is in some of this, right? So in Montgomery County, our ADAMS board funds one position to be an ODJFS liaison for our individuals who are in the jail. So there's no gap. Somebody comes out of the jail, we have a jail treatment coordinator who can actually send verification over to ODJFS that, hey, Mr. Smith has released from jail today and their Medicaid is temporarily turned on. Discharge planners have put the application in, we've got an application number. They turn it on temporarily.
so that they can start services that day. We can have our community providers either do the pickup there at the jail and get them taken to where they need to go. But there's literally no bridge or no gap in services because of that bridge. That has been extremely effective and important, specifically for our people who are on MAT, right? To make sure that there is no disruption in services for their needs.
Teresa, can I just ask real quickly,
Yeah.
on your roundtable or your familiar faces, is there a legal component where the public defender and the prosecutor are actually
Yes.
discussing and negotiating?
No, not during the roundtable.
Okay.
There's representatives from each office who attend just
Okay.
to keep track of information.
Gotcha.
That way, if they have a defendant that ends up back in the jail, we can say, hey, the roundtable was working on this plan. They had this discharge plan from the jail. Sometimes people, we're a county that runs off of client choice, right? So, sometimes people say, well, I want this agency because they think it's convenient or they think it's a good fit. Sometimes it's not a good fit. So at least being able to staff that information in those roundtables, everybody's on the same page of what somebody has attempted and tried and whether or not it's been successful.
Thank you.
Yeah. And I think that's it. That's just a few of what we're doing in terms of reentry in Montgomery County, and I'll be around today for questions.
Thank you. Circleville, where's my Circleville people? Anybody? Circleville, the metropolis, nobody here. What about Toledo? Nobody? I bring these two things up because I want to point out that the population of Circleville is about 14,000. That's the same number of people that we send to prison in Ohio every year. But the population of Toledo is 280,000. That's how many people go to our jails every year. Those people aren't getting services the same way reentry is provided for the state prison system. Let's figure out a way to get intervention to these folks sooner. Thank you, Montgomery County, Butler County. I have Lindsay Baker and Lieutenant, Adams from Butler. Sheriff Jones down there has got a unique program too. And one of the other things listen in on is the unique funding. Public funding there, jail funding with some Mars board support and community support there. I'm sure yours is a blend as well as mine is.
Yeah.
But go ahead.
Yeah.
Let me know what you've got.
Okay, yeah. Good morning, afternoon, I guess, at this point. My name is Lindsay Baker. I'm with the Butler County Sheriff's Office. I'm the manager of our inmate services there, and this is Lieutenant Adams. We work for Sheriff Richard Jones. Pretty fortunate. He is super supportive of all these efforts that we have been trying to implement specifically in the last couple of years, but we have really been working on treatment and reentry for the last 10 years or so, probably. We've got a kind of informal presentation for you guys, and it's going to mimic a lot of what you've already heard. I'm nodding my head as everybody's presenting, like, yes, that's a problem. Yes, we do that. So, really, historically, we've leaned heavily on our community agencies and community partners to provide any sort of services that we've had. We have been a part of Stepping Up, if any of you in here are familiar with Stepping Up. And we've been fortunate enough to do 2 sequential intercept mappings where we look at where the gaps in our community are for people that are suffering from mental illness and involved in the criminal justice system. Our most recent one was in 2021, and at that time we identified that jail reentry was one of our community's top needs. And so we really started focusing in on what can we do. So I'm going to talk about some of the things that we implemented as a result of that. But before that, I'm going to kind of go back. We have sort of 3 tracks as well that we do for discharge planning, and they're similar but look a little different. So we just for information, we book in about 8,000 inmates a year. That number is down kind of since COVID. I think we all kind of talked before and after COVID. Prior to COVID, I think we were somewhere between 12 and 13,000 a year. And now, yeah, we're just around 8,000. A good portion of those are, if they're being released back into our local community. So we know the importance of providing these services is that we want to reduce recidivism. These people are coming back into our community or they're coming back into our jail. So we want to do what we can to hopefully have them leaving better than what they came. So we work with 2 partner agencies in our community. One is mainly a substance abuse provider. The other one provides our mental health crisis services. So we have 6 full-time, 7-day-a-week mental health crisis service providers within our jail. They are focusing heavily on that, exactly what I said, crisis intervention. So suicide and homicide watch, speaking with people when they have death notifications, those sort of things. So although they are providing some other services, crisis intervention is the main focus of what they're doing. They do have 1 full-time discharge coordinator, discharge planner that works for them. So that is one of our tracks to discharge coordination that I'll kind of come back and talk about. Our other team is a team of substance abuse providers that are providing Monday through Friday. We offer a programming pod for both men and women in our jail. So that programming looks like morning and afternoon classes. It's got some
Peer support.
yeah. It's got substance abuse classes, IOP level classes. We offer peer support. We offer mental health, coping skills, mental health, trauma groups. We have a former Bengals football player that comes in and does a really fun and engaging kind of resource-driven class with them. We have parenting classes. We offer NA and AA. So we're really trying to set up, for those that qualify and request that, really set up what life is gonna be hopefully looking like when they leave. We require them to get up in the morning, make their bed, attend their classes, all those kind of things. So along with that group, our substance abuse provider has a counselor and a case manager that are working with them to provide discharge planning for those that are participating in that programming.
So I will interject. Andy brings up a lot of differences between the prison systems and the jail systems. Our sheriff, Sheriff Jones, comes out of the prison systems. His father was in the prison systems. He grew up in the prison systems. So a lot of sheriffs that are elected are coming through the state patrol side. We're very fortunate that our sheriff understands the prison side, understands what has been available to the prison inmates being released, and he is a very strong supporter of all of these services being in the jail. He knows it makes my job easy, but he knows that's what the community needs. And he's always trying to make the community better. He tells all of us, the officers, it's somebody's mother, father, brother, sister. If it was yours, how would you want them to be treated? How would you want them to come back to your neighborhood? Because they are coming back to be your neighbor. If we receive them this way, can we return them back to the neighborhood in better shape than what we received them? So he really supports all the services that we're doing. And for a long time, we've been able to get more and more in because of his support.
Mm-hmm. So, and I think along those lines, just as a background, so I started in the jail in 2017 as a contract substance use counselor in the jail. I hired on with the sheriff's office 4 years ago to kind of start growing some more of this programming and looking at and what was available to us. Though of the inmates that we book in, we only have about 200 to 250 that participate in that programming a year. So that leaves a whole lot of other inmates that still are in need of all of these services. But there are many reasons why they may not make it to programming. Most of all, they may not be in there long enough to get into that. So what we did 2 years ago now is, and this was huge, and this came out of our sequential intercept mapping and some discussions with our local Mars board, who is super supportive of what we're doing in our jail, is we decided that we wanted to implement somebody who was there every day in the jail that could be addressing needs from the time they walked in. We think about discharge planning in that same way. As soon as you walk in, we're planning for what's going to happen when you leave. And a big barrier for us that is time. Sometimes we don't have enough time to be able to make that happen. So we hired what we call 2 inmate post-classification assessors. We had kind of tried these positions in the past in a different way. We looked at them more in like a nursing medical way and found that that wasn't working as well for us. We wanted more of that kind of behavioral health line of questioning. So what happens is when inmates book into the local jail, it can be chaotic. You come into booking, it's loud, it's crazy. You don't know that the state that the person is in when they book in. They sit down, they're being asked questions by an officer in a uniform who looks no different to them than the officer that arrested them. And so the kind of questions that we're asking and the kind of setting that we're asking doesn't always lend itself to people being honest about what the answers are. They don't know what the repercussions of that is going to be. So these two people that we have working for us, they are there 7 days a week, not 24 hours a day. We have them on 10-hour schedules. But 24 to 36 hours post-incarceration, they are going back and meeting with that person. So once they've kind of been classified and gotten into their housing unit and things have kind of calmed down for them a little bit, they're going back with kind of a different approach. They are civilian plainclothes employees like myself. They're sitting down and they're going, hey, I want to ask you these questions, and they have the time that booking officers don't have to sit down. It may take 10 minutes, it may take 45 minutes, but they have the time to sit down with those individuals and say, okay, I'm going to ask you these questions and I'm going to ask them a way that makes more sense, is more understandable. So instead of ringing through these questions, they might say, do you have a history of mental health? And then depending on how they might say, well, do you have a history of being nervous or anxious? And have you ever taken medication for those things? Instead of asking those questions in a way that might not elicit the response that we're looking for. And it's twofold. We want to know, do you have a history of this that we need to be aware of so that we can potentially be reaching out to a provider that you might be connected to? We're asking if they have a case manager, if they have medication they take, but also we know for somebody who's severely mentally ill, if they need medication and they're not on that medication, we want to be able to start that back up as soon as we can. That's what's best for them. That's what's best for the jail, all of those things. So they're asking them things like, do you have insurance? Do you get Social Security? And all these things are digging at what do we need to start doing to make sure that you are connected to what you need to be connected to when you leave. So those two post-classification assessors were kind of a very, not all-encompassing, but a start to addressing everyone else that is also needing some of these services. So they hit about 96% of the inmates that come in. They're not gonna see somebody who books in and books right back out. But more than likely, if that happens, that person has some supports and some places to go. So they are potentially going to offer, and we didn't bring slides or any of that, but I will send out some materials. One of the things that has been incredible for us is, you mentioned the hospital discharge planning. We talked about this for years. How can we do something like what a hospital does, where we go, okay, this is not just a packet of resources that you have to shift through and make sense of what this looks like, but how can we give you something that's personalized, something that talks about the area of town that you're going to, the person that you want to meet with.
Transportation.
Yeah, all the needs, and not give you the stuff that you don't need or want, but only give you the things that you want to be able to utilize. So we created what we call a post-release action plan. It has their picture and their demographic information at the top, so it's twofold for them. They can take that with them to the BMV and use that as proof of identification. They can take that to the provider that they might be going to show that they got released and this is their information. So that is at the top. But then what we did was we kind of broke down some of all of our resource guides that we've used, and we put some topics in this. And we said, do you have transportation needs? And if you do, we kind of front loaded it with a lot of options, and then it's got the option to fill in something else as well. But we say, okay, if you're from this city, let's talk about the resources that are closest to you. Or if this is where you want to go, here are these resources. Or if you don't need this, we'll leave this blank for now. But that it has provider information, transportation, it's got information about Ohio Means Jobs and Job and Family Services. And then at the end, it's got kind of an additional area where you can put some other things. So it can be as detailed or undetailed as the inmate might need. So on top of, that kind of leads me a little bit into, on top of our two post-classification assessors, last year we also decided that we wanted to move forward in, although we have contracted teams, and bringing in a social worker who is with us on the sheriff's office team. She is our inmate advocate, and she is invaluable to us. She comes with a ton of knowledge, but she is not hindered by what contracted providers are required to provide based on what they can bill for, what their contracts are. She is working heavily with kind of that familiar face, frequent flyer population. She's very involved with our inmates that are getting kind competency evaluations and who may make it to Summit, but more than likely won't if they're found incompetent. It's kind of been laid on the jails and the communities to say, what are we going to do for these people? What's the plan? And I know we've kind of talked about this. Judges aren't sure either. And so they're like, let's put them here and let's see if we can make a plan. So she has had the ability to spend all day on the phone calling places, doing things if that's what's needed. So she has been invaluable to us in that way, and she can create some of these really in-depth plans. If the inmates are on medication, that medication list will go with them. So we create this action plan for them, and it goes in their file. We don't give it to them, it goes in their file, and it's on lime green paper. And the reason for the lime green paper is we want to make sure that the officers don't miss it when they leave. It's on the front of their jacket, and it goes out the door with them. It's the last thing they get as they walk out the door. Because when we hand them things, they lose them, they get thrown away, their cell gets tossed, it gets lost. So, and it can be revised as many times as it needs to be. It also has their personal information on it, so we don't really want that floating around the jail.
But in their time there, they're talking to so many different people through the medic's office, the social workers, on you can go here, you can go there, we can set you up with this. By the time they're walking out the door, most of them are so confused of, I can't go back to my home because of a protection order. I may have lost my job, I don't know what I'm going to do for money. There's all kinds of things they're thinking about to remember what that social worker said to them 10 days ago is not as easy. So this paper, it even tells them, like, for transportation, call this number, look on the back of your Medicaid card for your number, blah, 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 whatever. So very detailed information that will help them, especially people with mental illness. They really struggle when they leave of, how do I put my life together? They can't even begin to fathom how that would happen. So this detailed list, by just saying, look at the back of your card, there's the phone number. So that helps them actually be able to succeed once they get out, or make it easier for them to succeed.
Yep. So another thing that we've done outside of just the 2 contracted providers that we have is we have many other providers in our community that we want to work with, and we are also client choice. So as much as we can be, right? We work heavily with our providers, and as part of that reentry initiative out of our sequential intercept mapping, we thought, okay, we've done some different things because it's been a few years. The first thing that we initiated was we want a stronger partner with Job and Family Services. We want them in our jail. We want to figure out what we need to do. So we married that with our post-classification assessors, and they are asking when everybody comes in, do you have insurance? I don't know, no. We're doing the application. JFS is processing it for us. Everybody's getting applied for their Medicaid. They're also getting relinked to Job and Family Services and or Ohio Means Jobs when they leave. Outside of that, though, we created a reentry subcommittee that meets on a monthly basis. It includes every provider that has an interest in being a part of that. We do some roundtable discussions, but more so than that, what we found is everyone's frustration is, if you've worked with anybody lately, turnover is just high, right? So we all tend to go to that person that we know, and then all of a sudden that person that you know doesn't work there anymore. Nobody told you they don't work there anymore, and who do I contact? So because everybody had that frustration, I said, let's do this on a monthly basis, and the first thing we do is make sure that everybody's contact list is still up to date. Who is the person that I should contact at this recovery center if we have a referral for there? We made sure that everybody was on the same page with what a referral coming from the jail should look like, what it takes for somebody from your agency to be able to come to the jail and not run into issues. How can you come see your client?
Getting a release signed.
Yeah, getting releases signed. What do you need to do if you want to facilitate a warm handoff for your client? Because we know that that's what's best. And someone brought up the release time earlier. We all know that that is a struggle. And release times happen for many reasons that Andy talked about jail functionalities. But the jail simply is a houser of inmates, right, at its simplest form. And so what we tried to kind of help these agencies understand is most of our judges, were really fortunate in Butler County. A lot of them are very pro-treatment. They want to do what's best for the inmate. if you as the agency provider go to this judge, all of our agency providers have a criminal justice liaison, somebody who's in the courts. If you go to this judge and say, hey, I have this client, I have a referral for treatment for them, their out date is on Saturday, could you go ahead and send a release for Friday morning and release him to us? Most of them are very amenable to that, but it takes that communication, and the jail isn't really it doesn't have the ability to do a lot of that. So we rely heavily on our community providers for that. We will communicate and we'll make sure that those things happen, but we rely on our providers to say, hey, this client wants to come to you. If you want to service them, here's kind of the way that works. And that can work for sentenced and unsentenced inmates.
And we have weekly classification meetings where these outside providers can attend as well. The ones that are attending have all these court liaisons, so we can talk about inmates that are of particular needs. Like, we know that how they're functioning in jail, we know that they're withdrawing in jail, or they're participating in programming in jail, whatever. Then they can go back and that liaison can approach the judge and say, hey, look, we know they're doing the programming in jail. They would be good in this programming here, or they're kind of reluctant, so maybe they need an inpatient programming. So it just gives them better information to provide to the judge to make better decisions for that individual to be more successful in the end of what is actually going to happen with them.
Yep. Yeah, trying to think what else we've got going on. We have so much, and I just kept hearing and writing my notes about everything that we want to do and everything that we've been trying to do.
And Lindsay talks about with the two girls that start talking to the inmates within the first 20 hours of their intake. We also have the provider in the jail that is also getting a list of everybody that's been booked into the jail. They're looking for anyone that's more critical or someone who is the frequent flyer that they know about, that they're going to go talk to them immediately as well to say, hey, look, we know you're on some psych meds, let's get back on them. Or we know you're homeless, so let's start talking about that. So they're being approached by different people based upon different needs. So it's not just everybody's getting the carte blanche, here it is. We have the specialists that are targeting those people that we know are the frequent flyers, the high risk people.
Yeah, we have a heavy focus on making sure that that we're screening inmates in a way that they get their needs met as immediately as we can. So, yeah, go ahead.
Oh, I was just going to ask, are you able to release individuals with the actual med or prescription? You do the prescription?
No.
Yeah.
Yeah.
We are not a pharmacy, so we cannot dispense medications, so that's kind of a downside.
Gotcha.
But like on the sex offenders, that's why I asked, we have a big issue with finding housing for a sex offender that's being released. So most of them will go live under a bridge somewhere because no emergency housing will take them. So I was very interested in your
Yeah, kind of what you're...
housing situation.
We would love a committee to be developed.
Yeah.
Yes.
Yeah.
I feel like the denser we get in the state of Ohio and a lot of our urban areas, we literally, and it's not location to location, it's property line to property line for that 1,000-foot rule. And in Franklin County, it's getting to be where there's nowhere someone with a sex offense can live.
Yeah.
We're
Correct.
just so dense.
Yeah.
And so I feel like there needs to be something legislatively that we need to start looking at, because if Debbie's daycare decides to go into business, that's great. But if you're uprooting someone who's been in their residence for 10 years, been offense-free, been a stand-up, resident, and we're making that person uproot themselves and potentially their families, I just think there's something, we've got to address this in a better way.
But it's broader than that. So we've had the elderly person in a nursing home that gets assault charges from a nurse, and now the judge is kind of like, well, this is ridiculous. They have dementia, blah, 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 and release them. I now have a court order to release. They can't go back to that nursing home. What do I do with them? I can't put them on the street. They have no family that can take care of them. That's why they were in a nursing home. What nursing home is going to take them now that they've got a violent charge put on them? So that's a whole different, and our population's getting older and older, so it's a bigger issue. And then you have the DD people who are in a housing and there's an assault charge filed, and now they can't go back to the group home. Where do they go with an assault charge? It's hard to find housing for them. So there's a lot of different populations besides the sex offenders that it's difficult to find placement, but I have a court order to release, and I just can't put them out on the street and say they're safe. So fortunately, the sheriff has hired in some experts who can get on the phone, has worked in this field long enough that they know, like, hey, up in Dayton, there's this place that will take people with sex offenses. Or up in Franklin County, we know there's this place that will take DD with assault charges. So it's difficult on a lot of different fronts when people are released and you have a court order. I can't say I'm going to hold them till 3 o'clock and find a place. I've got to quickly get them out of here.
I want to, if we have time, I just want to readdress the medication thing really quick because that's a huge thing for us. Especially, we want to continue people's meds, but if they come in and they need to restart their meds, that's a really disruptive thing for people to restart their meds and then go off their meds when they come out and all those sort of things. So one thing that we do for people who come in and start any type of, if they see our psychiatrist or our psychiatric nurse practitioner for mental health meds, and they are not already prescribed those meds or already connected to a provider, one of our in-house providers has a contract with our local board to provide what we call the connections clinic. So they have a prescriber and they can bridge that prescription until we can get someone in to see a provider. So I'm not sure exactly how long it is, but they're able to immediately see them and get that bridged for them. If they're already connected to a provider, we are doing our best between our inmate assessors and our contracted service providers and our inmate advocate and myself to reach out to those providers and say, hey, come see your people. Come see them. We want you to come see them, or we want to get an appointment set for them. I mean, we know what's best is if we bring in the person that this person already knows and is comfortable with, and if their case manager can come see them or their peer supporter can come see them, we know that that's what's best. But we're doing our best to make sure they have an appointment set or somebody's picking them up or whatever we can do. Or worst case scenario, they get out at 5 a.m., they know this green sheet is their reminder that, oh yeah, today I'm supposed to walk over here and go see this person at 9 a.m. Or 8 a.m. or whatever it is. So those are kind of our two answers to not releasing with a prescription. They'll come with their med list. We've worked really hard to make sure that our community providers really know myself and our inmate advocate in particular. They call us all the time for all sorts of things. But we want to make sure that that stuff goes with them because we're looking at that continuity of care. What is best for these people? And if they're going to return to us and we know what was going on when they left, it gives us a better start the next go around. And hopefully we're kind of shortening the gap with those issues as well. So.
This is the first time I've heard about all three of these reentry programs in depth, and I've been beating the bushes in Ohio for 2 years on reentry and developing our internal program for more than 5 years. But it's the first time that I've heard these details. There's a lack of information sharing amongst these county jails. There is a lack of understanding, a lack of a place to go and share these ideas. And that's one of the reasons I want to take a moment again to stress to you the importance of this opportunity on November 8th. You've got the flyer there at your desk, and if you don't have one at the far table, there's plenty around here. We'll get them for you. A convening again to learn more about these programs, to find out some more best practices, and to keep this momentum moving forward. In prison, people are sentenced, they show up, they have an out date. They begin to work carefully and diligently like dominoes falling into place as they reach their release date. They have a case plan, they are released, and they have resources in the community to go to. Jails, for the most part, don't have time for all that. And you can hear by a lot of our programming, a lot of the things that we're dealing with, we've had to carve away a lot of those other pieces, and we are back down to mental health, behavioral, the whole behavioral health spectrum, everything. Health and well-being, that's where we're back to. And not everyone that comes to jail wants that help. We're very well aware of that too. We booked 8,000 people in Lorain County. They booked 8,000 in Butler County last year, 17,000 in Montgomery County. Not everybody wants help from their reentry person. They don't need it. They do have a job, and they just did stub their toe, and they're going to be back out, and they're going to be doing okay. But if you're there and you're at the place in your life where you want help and you're ready to change, and there's nothing established in there to support that ideation, then you're walking back out in the same social network that you left, with the same transportation issues, the same where you're going to sleep issues. Just saying these are important resources to be made available to this community. A lot of this originates right back to Eve and stepping up. Our Lorain County program in 2017 originated with our sequential intercept mapping exercise. We too identified this gap, this connection, this linkage between what you might get for treatment and coverage and services in the jail, and then shot out the door, and what do you get when you're in the community? Well, you're back to your same old decision making. So that's where this started. Our pilot program started there. Stepping Up does wonderful things. But county commissioners, mental health boards, everybody in the community needs to pay attention to those people that are in their jails and get better resources to them in effective ways. The population of those people who are in your jail may not all be ready for it, but for that nugget that is, it's important to have that. Let's talk about Lorain County briefly, and I'll make it quick because we do want to get to our Supreme Court news. In Lorain County, we have one employee, and rapid reentry, the thing about rapid reentry, it's rapid because you need to respond quickly. That's all it is. You heard Franklin County's, their resources hover just outside of the jail. They thought about it when they were building the jail. They built a spot outside of the jail. They are separate. They do work on their in-reach. Montgomery County is in the jail. Butler County is in the jail. Lorain County is in the jail. We have one employee, $79,000 for salary and benefits per year. That money is provided through an agreement with our MARS board. The pilot program was initially funded with TCAP money, and we're thankful to have Bureau of Adult Detention Director Chris Galley with us here today. And TCAP money through ODRC was the impetus for this change. The sheriff said, okay, we're getting this surplus of money coming in. You have an idea you want to try out? Go ahead, try it out, see if it'll make a difference. They put it in place, looked at the data for a couple of years, and it has evolved into case management. It has evolved into rapid reentry. One employee, 40 hours a week. I would love to have 80 hours a week. I would love to have 24/7 coverage, but we don't have it. What can you do in that 40 hours? We have a menu of services that we approach the inmates with. You've heard from other people here this morning. You know that when an inmate is booked in the jail, they may not be very responsive to the correction officer that's booking them in. They're not always truthful on their questionnaires. They aren't always forthright, and sometimes it's because they're in crisis. They're detoxing. By the way, your jails are the biggest detox provider in your county, without a doubt. Your jail is. The menu that we've developed is recovery supports. So treatment, do you wish to have treatment while you're in here in the jail? And are you interested in treatment on when you get released? I can provide you linkages for that. So let's stop there for just a brief second. Everything that we have in our reentry program, rapid reentry, takes place outside of the jail. Well, not everything, 90% of it. These services are already available in our community. All we're doing is taking the time to link the person while they're in jail with that service in the community so that when they get released, they have a smoother path to it with less obstacles. So we haven't invented anything. We haven't hung any shingles on the outside in the community, haven't drawn down any more money from anywhere. We're just linking people with what's already out there. And you have to get to those people to let them know this is a jail. You've got to act fast. 24 hours is sometimes too long. You have to adapt your way of doing business. Your normal business model is not effective in this jail environment. When you get a referral from our reentry worker that says Jane is interested in peer support services, then you need to get somebody to visit Jane within hours, because Jane might get released tomorrow morning and then that ideation is gone, or she may not make that link. If you can create that therapeutic bond before they hit the door, we know that outcomes are improved. Recovery supports, including Narcan and soon-to-be test strips for both fentanyl and, somebody help me, what's that new one? Xylazine, thank you. Homeless outreach. We have some homeless resources. If you are a veteran in our jail, we are coming to talk with you. We are the liaison for our specialty courts in the county. So we have a recovery court, a wellness court, and a veterans court. Chemical dependency assessments while you're in jail. Transportation needs. Look, public transportation in jails across the state are probably not strong. Sure, in our metro areas like Columbus here, public transportation is pretty well. In Lorain County, it's sketchy at best. It goes from Elyria to Lorain. But we do offer some bus tickets there, and we did increase the bus loop to come out to the jail. Peer supports. You've heard peer supports many times this morning. It's incredibly important that they get that support and that bond before they get released. Employment, look, we don't do a whole lot with employment. We have 75% of our inmates are released within 10 days. We offer felon-friendly employer referrals. Medicaid and SNAP benefits. We're signing people up for that while they're in jail if they choose to. And even that is important. If you get that with a 2-hour sit down with 6 or 8 people and you've got one Medicaid application out of that and you send it out, that person gets released 2 days later. At least that process has started, because they may not seek it out when they're in the community. And we do act as a link for probation and parole within the jail as well. So we've got one person, 40 hours a week. All they do is every morning they come into jail, they run reports, and those reports identify 3 target populations. Are you withdrawing from substance? Are you flagged for withdrawal? And that's related to alcohol, benzo, and opiates most frequently, because those are the ones that require medical intervention. So that's our prompt for that. We don't have time to assess every single person that comes in the door. Not possible, not with that person. Did you answer yes to any of our 3 homeless questionnaire questions? And did you identify as a person who has prior military service? If you answered yes to any of those 3 things, our reentry worker is seeking you out. So she runs the list, she gets the list, she pulls the list, then she goes to the housing areas, and she is seeking those people out to at least interview them and offer, this is our menu of services. Is there anything I can help you with today? Are you interested in anything? And if you are, then she starts making referrals fly, faxes, emails, doing what she can do to get people linked up. That person may be gone quickly. Medicaid, they're all important. They can all make better outcomes. That's what rapid reentry looks like. Do we miss some people? Sure, because some people get booked in at 4 o'clock in the afternoon and then get released at midnight. So that person may have came through and we had no contact with them. If we had longer hours, we would touch more people. We've got 2 years worth of data, full-time data. I'm not going to bore you with it here, but if you want it, you can contact me and I'll share it with you. But the data shows us that about 20% of our population is contacted by rapid reentry, booking 8,000 people a year, 20,000. And I can tell you, because of her workload, that she is at capacity. She can handle no more than what she has. Half of those people we seek out, the other half come voluntarily. It's important to have your rapid reentry advertised heavily in your jail, accessed through traditional paper forms, on your kiosk, on your tablets if you have tablets. Make those things readily available so that those people know there's somebody that will listen and wants to help and has some resources to provide you, and will give you Narcan if you are interested in Narcan before you leave, but will also get you connected with treatment. Most jails, all jails in the state, have some sort of in-house treatment for chemical dependency and in-house mental health staff. We have a very robust mental health staff in Lorain County, and we have very robust mental health, medical as well. But it's not looking heavily towards what's outside. It's looking about managing outcomes while you're in jail. That's rapid reentry. I'll jump back into it if we have time. But Justice Stratton, you want to come up and take care of the next part here?
Carlton Moore, many of you knew Carlton Moore. He went to the Bureau of Justice Assistance. When I started getting all these emails from Andy with the data and the statistics and information, everything, I started sending them up to Carlton, and I believe he invited Andy to be at a national presentation. He was the only one he personally invited to talk about this, so Andy's just been really my hero in pushing this and leading it forward. On the 27th, I'd said the 20th, but it's actually going to be on the 27th. It will be in your Stepping Up newsletter. Hopefully you are all signed up for it. On the 27th is the MAT training for jails. This is our 9th training. There are 8 trainings on the NeoMed website already that we've done. There's a 6-part session on connecting incarcerated individuals with local services. We have big hospitals, small counties, different programs. We have a great one on aging. It's one of my favorite, on aging in the jails and dementia and what it looks like. I have sent that to so many family and friends who have relatives they're struggling with to understand it. And so that's just a really good training for your jails if you haven't accessed it yet, and put on your site. It's at noon. It's a webinar by Zoom. This is one on MAT and how to recognize withdrawal in a jail setting. And then if you're in a county that's not a Stepping Up county yet, please reach out to me to see if there's some way I can connect you. If you're a Stepping Up county, you get a personal visit by Zoom from a team of 8 with all sorts of resources. We do local presentations. Franklin County was our very first nationally, one of the 6 picked, and they remain a star for us. You get a free sequential intercept mapping, mental health mapping if you are a member. It's a $30,000 process if you buy it on your own from NeoMed. The Landlord Mitigation Fund, which allows landlords to apply for the fund if they have someone who skips, destroys things. They don't have to go after their insurance or go after the individual. That's only open to Stepping Up counties. Because of Stepping Up, we got the reimbursement for MAT and psychotropic drugs. There's a lot it's done, but if your county's not a county member yet, please let me know. I would love to sign them up. And so, and I wanted to also introduce, before I introduce our last speaker, I want to introduce Sam Campbell. If you'd stand up and wave, Sam. Sam is the new director for specialized dockets at the court. I recently sat down with him and was very impressed with his passion and his understanding, and he's already asked his staff to get on multiple of our AG Task Force committees, so I'm very excited about the initiative he took on that. So if you have anything to do with specialized dockets, that's your man over there to talk to. Thank you. And so then I want to introduce Stephanie Nelson. This is actually going to be a very special presentation. She's Director of Court Services, and she has been, I don't know, I probably email her at least twice a week, if not more, on all sorts of issues. But I'm so excited to be connected back with the court. As many of you know, I wandered in the wilderness for 11 years, and now I'm back working with the court on everything. It's wonderful. Chief Justice Kennedy is just a great partner. She's part of our steering committee now. But anyhow, she put together, one of the very first things she did was put together a task force on reentry. She was very passionate about it. She really liked some of the reentry programs she saw that they were doing for veterans, and she wanted to use that as one of the models. And then she got very interested in jails with Andy, so they actually took up jails, not just prison reentry. But I understand this morning, hot off the press, that the justices just approved the final report. So you are going to get a first-hand final report from Stephanie on that. It's not going to be officially released until this afternoon or tomorrow, I believe. So embargo it until you hear the official release. But we're very excited that this group is going to hear it first. And what more perfect audience for you, Stephanie. Thank you.
Well, thank you so much, Justice Stratton, for having us. Really appreciate that. Can you hear me? Louder. Louder, okay.
That's not a mic, it just records.
Oh, okay, it just records. Okay, so I will, yes, be louder. Yes, so thank you, Justice Stratton. Chief Justice Kennedy convened in the Reentry Month last year of April of 2023 and started off this reentry task force. And one of the things you'll hear her talk about it's very near and dear to her heart. Before she was a judge and a lawyer, she was a member of Hamilton Police Department, and she tells the story of when she was out one cold night and a gentleman who had been in prison and was looking, for a place to sleep and was about to do something that he shouldn't. And so that really struck her. And so this has always kind of been with her throughout her career. So as Justice Stratton said, she convened the task force on reentry, and I'm happy to say that the report is being finalized right now in our public information office. And so you will, as I told Justice Stratton, I'll send it to her and she can disperse it to everyone. And in fact, this the task force on criminal justice and mental health, there is a recommendation that part of the rapid reentry release on jails goes to that, to continue the work of moving it forward. So I want to just talk a little bit about the summary of recommendations. The group had pretty much every executive agency on it. And in fact, there are several folks who are here today that were on it. So if you just want to raise your hand, I see Dr. Lisa Schoaf, I see Ronnie Burks from the Reentry Coalition, Chris Galley from Department of Rehabilitation and Correction, and Andy Leventhal over there. And Justice Stratton is correct. We divided it into two pieces. We did a prison subcommittee, and then we also did a jail subcommittee, because we really wanted to focus, as Andy is, fond of saying, that it's 1 to 15 ratio. Folks being released from jail, 15 versus 1. And so we recognized that and really wanted to make sure that we were capturing those pieces as well. So the recommendations are split into 3 groups: judicial, executive, and legislative. And it's really a roadmap for the state of Ohio. And looking at the first are the judicial branch. So when you're looking at, as Justice Stratton introduced Sam Campbell, really looking at our reentry dockets. And we have 10 reentry dockets in Ohio. And this group, the task force, was chaired by Justice Krissa Hartnett, Judge Krissa Hartnett. I've elevated her, and she's in Stark County and has a reentry certified specialized docket. So she was the chair, and I know you all know Chris Nicastro, Department of Mental Health and Correction Services, and they have a lot of services that are provided to the prisons and the peer support program. So those were the chair and the vice chair. But going back to our judicial branch recommendations, so we have 10 right now in the state, and we have 254 specialized dockets, and that includes reentry, veterans, drug, mental health, the juvenile populations, human trafficking. So we are really going to focus on increasing those reentry dockets. And whether that's, if you have a drug docket, which we have about 150 in Ohio, and maybe just having a track that focuses on reentry. So, as Sam and I were talking back there, I think the counties that presented today are ripe for a reentry docket. And so we're going to be reaching out, and we're very impressed by all the services that you provide. So that's the first piece, really focusing on how can we increase our specialized dockets in Ohio. The second is really supporting judicial release. And how do we look at, right now there is a judicial release statute, and how those practices, how the judges look at that. And I know, when we were talking in the discussion, if there's a reentry coalition in the county, and right now there's 63, and so that really helps the judge look at holistically all these services that are available. So if we can coordinate and look at that to really help support judicial release in the counties and educate. So again, when you see this report, you'll see that it's a lot of collaboration with everyone that's here: prosecutors, public defenders, Ohio Legal Help, the Poverty Law Center. So this is, central to how this work gets done in Ohio. And there's already a lot of really good work going on, as we've seen this morning. The next piece is really meeting those legal services needs. And how do we do that? And how do we, coordinate with legal assistance programs? So these judicial recommendations are really where you'll see the Supreme Court taking the forefront. The next piece is removing housing barriers. And so there is a lot of research that shows if there is not a place to go, then there's not going to be success. So looking at these, certificates for the qualification for housing. And we heard from really good groups, Fuse in Franklin County, and that are funded by Ohio, Mental Health and Addiction Services, and really seeing if we can replicate those. The next issue is very important, addressing the stigma around this population. And I remember back when Monica Kagi was our specialized dockets manager, who's here in the audience now, has moved on, she would always want us to use substance use disorder language instead of addiction. So the Supreme Court is going to really focus on providing templates and packets to the local communities, and so that we can help address that stigma. And the next piece for the judicial branch is really strengthening those family and community supports. So the Supreme Court will work with, Job and Family Services, DYS, DRC, looking at visitation, looking at the services that are provided to those families to strengthen them. One thing that I want to say is that before I go into the executive branch recommendations is that we have a commission on specialized dockets. So Sam Campbell, as was introduced earlier, he is going to be chairing a subcommittee on reentry implementation. So he's going to be looking at all these recommendations, and that will be really the place that will house to see, what we need to do and where we go from here. So if you're interested in serving on that, please let him know, because we would love to get more community and state support. So please let him know on that. The next piece are the the executive branch recommendations. And again, we had everyone represented on this work group. And this was, as you've spoken about, linking to healthcare, how important that is to have your medication, whether it's prison or jail, to have your MAT, to have everything that you need. Really impressed by the turning on that you mentioned with the coverage with JFS. So just finding those models and replicating that. The other piece is increasing the awareness of resources. So right now there is not really a dedicated place. There is relinked.org, and so we'd really like to make that, showcase that this is the place for reentry resources all over the state, so that not only, you all who are doing this work can find it, but also the families and those in the reentry population. This is one place to go, and this is where we'll put all the resources. The additional, forming additional reentry coalitions. I know that you're in 63 of the 88 counties, and that's wonderful, and we really want to, continue that growth. Expand the peer support. So Ohio Moss, yes, the first in the country to have this program, and the partnership that they have with DRC. So really looking at how can we help facilitate moving that forward. The governor has the expedited pardon project, so really working there to see, again, how can we facilitate that moving forward and growing, because there is a huge demand. And we heard also renewing driver's license policy. So looking at those amnesty days, working with the Department of Public Safety to look at are there anything that we can do to really facilitate so everyone might be able to start out with some lower costs there. Increasing education and employment opportunities. So we really heard from Ohio Department of Education and Workforce. There's already the Ohio Association of Community Colleges and the Ohio Penal Education Consortium. So really expanding that, that's now in 6 universities. So looking at that piece, and then also looking at the vocational training. How do we ensure that when those in prison, have a welding program, that they come out with the proper certificate, and then they can take that and they can use that. We were invited up, thank you so much, to the Marysville Correctional, and saw all the programs that were there, the cosmetology, the dog training, the horticulture program, and it was, I can't even name, 10 or 12 programs. And so that was really exciting, and I think just showcased that. One of the things on that tour, I remember saying to the warden, saying, this seems like time intensive for you to give, tours. And she said, this is how we get our community volunteers. And we have 500 community partners that help make those vocational trainings possible. So I thought that was, you're really advocating right there. So you see the results. And then finally, the last but not the least, Andy, is the enhancing the jail release. So really looking at the Jail Advisory Board and the Buckeye State Sheriff's Association Community Corrections Committee, and looking at how do we expand these reentry programs, and how do we, put on a program and education. It sounds like you're already ahead of the game and doing that. But one of the specific recommendations embedded in there is that looking at the AG's task force and the Diversion and Reentry Subcommittee and the Ohio Association of Local Reentry Coalitions to assist moving the jail rapid release program forward. So again, it harkens back to collaboration and building on what is a very solid foundation in Ohio right now. And then last but not least are the two legislative branch recommendations. So clean slate legislation, you've probably heard of this, and an effort to automate that process. Still leaving, some violent offenders to the petition process where it's not automated, but really looking at that. We had them present, and we brought in some legislators to look at that. There are some pieces right now in the legislature, so we'll hope that that continues. And then the last piece, as we've heard, is ensuring the identification document process. That's great. I forget which county, so forgive me, has the picture and the ID, I think it's Montgomery, and taking that to the BMV, but really looking at, they need that identification, whether it's a state ID or a driver's license, and how can we help facilitate those efforts that are already there. So I am happy to take any questions. Again, as Justice Stratton said, this is hot off the press. The Chief Justice, Sharon Kennedy, will be announcing this. And I know that it's very important to her, and it must be important to you all in the room. So please, let us know, let Sam and I know if you want to be part of the implementation or a certain group, because we're very excited about this work, and we've only just begun here. So thank you very much. I appreciate your time.
Okay. If anybody hasn't, does anybody in this room have questions? That will save some expediency. All right, come on, let's go.
I have a question for the jails that are doing some from Sandusky County. We book in like 1,200 people a year. Our daily population is 85. If we reach 100, our giving is like. So we also have one person that's doing all of our jail programming and our reentry. Very small county, almost no funding. Community partners so far are not overlapping well. Do you guys know of any other counties that are also small, like us, that I could maybe reach out to and see how they're managing all the things of the bigger counties? I don't have problems, but seem to have more.
All right.
Warren or Claremont County.
For the recording, for those who couldn't hear, we have Sandusky County. Sandusky County inquiring as to any other resources from small counties that similar to them in size that could be a benefit to them to look at. And we had a response that said Warren and Claremont, and Preble. I'm also aware of Tuscarora. And these are just programs that we're aware of. I don't have any details on them, but certainly we hope to learn more. It'd be wonderful to get everybody on the same page, get a concise knowledge of everybody. Other questions? Thank you for that. Yes.
So I know that, especially with stepping up, getting validated screening in jails and booking is an important aspect of this. How are programs screening for needs? We've heard a lot about almost like self-report from folks as they're leaving the classification process? Are they using similar or the same validated screening assessments to determine need upon reentry, or are there additional tools that are being used?
So time being the biggest crunch, I can only tell you what we do in Lorain County. In Lorain County, we use the questionnaire that is approved by the state of Ohio as a screening tool for receiving new inmates. That has both medical, mental health, and some substance abuse questions in there. If the medical staff determines that this person is at risk based on those responses and their intake examination with that person, and everybody is examined by the nurse within 2 hours of arrival, because we are accredited through National Commission on Correctional Healthcare. That's the standard for them. If they're flagged, then our reentry person is going to go find them. But that's Lorain County. Not everybody has that chance, and we're only booking 25 people per day. We average 25 people per day. So what kind of assessment can we do with each of those 25, and what kind of manpower do we have for it? What do you do in Montgomery County?
So Montgomery County, we have, everything goes through our correctional health care vendor who is, of course, has a screening tool that meets the minimum standard, but it actually has a little bit more to it. But one of the caveats of having discharge planning through that correctional health care vendor is because they're looking at not just information that's given by self-report, but they have historical data. So if somebody's been in that jail before, they have that historical data as well from medical and mental health. So again, when our discharge planner goes up to see someone, whether they've made that request that they want reentry planning, or they've been sentenced to that jail and they've just gone up to talk to them, they've already gone up with a little bit like a snapshot of what this person has historically required. So because it's all kept in that electronic medical record.
I would say for Franklin County, we're very similar to Montgomery. We do the CAL screening tools, and medical provider does that. We do have an MAT coordinator then that takes those who are screening on the clinical opioid withdrawal scales, and that's what they use as their list to go meet people. We also have an in-reach provider, Southeast Mental Health. They're one of our largest mental health providers here in Franklin County. If somebody triggers on the behavioral health, and it's Armor's medical services provider, it's their own proprietary behavioral health screening. But if they trigger that, then that referral gets sent to Southeast Mental Health to do a more intense screening.
I just have more of a comment. Stephanie mentioned that I'm with Reentry Coalitions. I'm actually with ODRC, but we actually do actually oversee the Reentry Coalitions. And I just wanted to just echo what Stephanie said, because we do have Reentry Coalitions covering 63 counties, and many of the counties that are here today. And so if you're not connected with your local Reentry Coalition, let me know. I can get a list out to you. Montgomery County has one of the strongest Reentry Coalitions in the state. They're phenomenal. Franklin County, another county. Butler County has a new Reentry Coalition of 4-7, and they are phenomenal. And a lot of them have received funding from our agency to expand. And it's not something that we may be able to do ongoing, but we've done it for now, ODRC. And so I know that they would want to be able to help. And with ODRC, we haven't limited them just to people who are coming out of state prison systems. We tell them we want you to serve everybody because we don't want them in our system. So again, reach out to your Reentry Coalitions, and if you don't know who they are, please see me afterwards, and I'll get a list emailed to you as soon as possible. Thank you.
Yeah, I failed to mention our Office of Reentry being a community partner for Montgomery County. That is correct.
I figured that.
Thank you. Thank you.
There was a question online. Somebody wanted to know about the Rapid Resource Center. Is it open and available to the inmates 24/7 upon release?
It's 24/6. Sunday, we're 8 to 5.
24/6. Sunday is 8 to 5.
Well, I don't know about you, but I think this has been a really educational event with so much, almost overwhelming information. It occurred to me that maybe the Reentry and Diversion Committee, which has the ODRC co-chair on it, Daryl, might want to think about doing a survey to our counties. We did a survey on psychotropic drugs, and that's how we found out how much their need was, and we got the legislation passed to do funding for it. So maybe a survey of what are your programs, and you can work together. Actually, what you could use is Office of Criminal Justice Services. They have the Lisa Schoaf is back there. They have a research consortium that is free. I'm using them right now to do a survey on Stepping Up, our second one. Maybe they could help design a survey collecting reentry data and information and find a university that will work with you free of charge to do that. So maybe that's an idea to pursue, to get some more information and start doing some of the sharing, because there's just so much sharing that needs to be done. And I'm looking forward to Christopher as our new bureau chief to really help us get jails to start using the 9 trainings we've already done, share information like we've gained today. The PowerPoints, any presenters, please give your PowerPoints to Carolyn, because we will send them out to our whole task force. In fact, I can even put them in the newsletter so that a lot of people will get them instead. And it occurred to me that, Sam, we're going to need a member on the Stigma and Education Committee of the AG Task Force. They designed a whole media kit to teach the media how to talk about a stigma and use the proper words and language. So we're looking to really get your help on that committee. It sounds like it meets one of your goals over there. So I want to thank especially our presenters who all came some long distances to talk to us about what they're doing. We are so appreciative of what they've done. We're appreciative of our 3 co-chairs. This has been one of our extremely active committees. If you want to join it, please let Carolyn know, give her your name and email, and you can join the Reentry Committee or one of the other 14 committees. The Jail Training Committee is a great one. I've already gotten Christopher on that one, make sure he's connected with it. Chief Stobart is one of the co-chairs of that committee, and we're doing the MAT on the 27th, as I said. And thanks so much to Carolyn for helping organize all of this, and thanks to Pete and Donna for recording it. And with that, we are now, yes, sir?
Your Honor, if you're about to close, may I have 2 minutes to address the group?
Sure.
I know I'm not on the agenda, but
yeah,
you probably know why I want to say something.
Go ahead.
My name's John Benninghoff. Look me up on LinkedIn and find out anything about me you would care to. But I'm on the board of directors for Stockhands Horses for Heal. If you don't know about them, and I don't think most of you do, please Google us. Just put Stockhands in the URL, and Stockhands Horses for Healing will come up. We have 35 horses in the stable. We do equine therapy. We have 35 therapists. The humans that work there are not the therapists, the horses are. The healing that happens for veterans, autistic, Down syndrome, criminals, people that got sideways with the law, probably should use a different term. I helped found the Delaware County Veterans Treatment Board, which is how I got introduced to Tim Funk, our executive director, and he nagged me for 3 years to get on the board. I finally acquiesced and said, quit bugging me, I'll do it. But it is the most fulfilling thing I do. I am a Vietnam veteran with PTSD. He is a Gulf War time. I'm not sure exactly where he served. I know he's been in the desert and he's been in Africa. He has PTSD. We do the things we do for veterans and other people as much as for ourselves. We are healing ourselves by helping. And we are the largest veteran-serving organization in more than just Ohio, but I can't say regionally. Western Pennsylvania, some of Indiana, etc. Please Google us. Please reach out to me. I'm the easiest guy to get hold of. My contact information's in my LinkedIn account. Call me, email me, call Tim. Please get to know us. We conduct tours, and we want to expand our reach and our services. So thank you for your time. Thank you.
Yes, and they're also doing work in the prisons now. So they have been taking their horses into prisons and would like to expand that. So if you wanted to make a bigger connection there, that would be wonderful. I'm sorry, Stephanie?
I just wanted to announce one more thing too. If you're interested to hear more about the reentry report at the Specialized Docket Conference, it's free. October 25th, Friday at OSU. There'll be a reentry panel. It will feature Andy Leventhal, Judge Chris Hartnett, and Chris Nicastro.
Great. And we did feature Stockyard at the last Veterans Conference. We had the Judge Hemeter from Delaware Veterans Court, and we had some people from I always want to call them Stockhand. Is Stockhand or Stockyard? Stockhands. They are really a wonderful program, and we're really hoping to expand that therapy, which reminds me that I think it's November 14th, it's the third Thursday of November, is our 10th Veterans Conference. The Chief Justice has now brought it in-house. I did it in-house for the first 4 years, and she and I partnered on the outside, and now she's bringing it back in-house, but it will still be at Villa Milano because it's got great food and easy to get to. And it's going to feature veterans, special populations, aging veterans, veterans with disabilities, PTSD, TBI, children of veterans. So it's a real great program. So watch your newsletter again for that announcement, and we're excited to do that once again with the Chief Justice. And I think, any more announcements of conferences or anything? Yes. Oh, or really? Yes. Introduce yourself because you were mentioned in the report.
Yeah. Hi, everybody. I'm John Ryder with Relink.org. I know Stephanie mentioned us in her report. We are, for those of you who don't know, we are a free website database with about 15,000 resource providers in all 88 counties of Ohio for addiction recovery, behavioral health, food, clothing, housing. It's free and anonymous and reentry. Thanks for that. Free and confidential to search our website. Free for organizations to be listed on our website. You can search it by city, county, or zip code, and email yourself or someone else resources, print them off. If anybody wants to speak with me afterwards, I'd be happy to talk with you. Thanks.
Thank you. And it might be good to pull you into the survey to see what more information that would be needed to enhance the relink. So maybe you could work with the committee on designing the survey, and if Lisa can get us some professors to take it on for free. I'm working with Bowling Green right now, and they're just fabulous. They know how to do all the technical stuff. They know how to phrase the questions. They know how to tabulate the information. They were great to work with. We got the same group that we had 4 years ago, so I can really highly recommend that we work with them. So, Lisa, you got a new job over there. Yes.
Do you know when that survey is going to be released?
It's my survey.
Your new one.
We just sent it out to the county coordinators. We did it a little different this time. Last time we just did county coordinators, but they're so varied. One may be a jail administrator, one may be a judge's assistant, one may be someone from the Department of the Mental Health Board. So we added a researcher that's called a qualitative researcher, and we had the qualitative researcher interview 10 people that really know the bigger picture of the effects of stepping up. Like Dustin McKee was one of them because he's been with us. Melissa Knopp is one of them. Luke Russell because he's been, so involved. So some key big picture so that you can talk about the changes that have happened from stepping up that a small county might not see. So we expect to merge the survey that's hit everybody's desk today. So if any of you are in the counties, you get your coordinator to sign. They can't answer all the questions themselves. There's questions on everything. So get with your county coordinator. Hopefully they'll reach out to you and get your answers on that survey back because it's so important to see what's going on. So, yeah. All right. I see that we have reached, we are giving you back 45 minutes. You can have some lunch. Please, if you don't need to go right back home, grab somebody that you haven't really gotten to know or you want to renew acquaintance and take them to lunch. There's several good restaurants. Just get on your Google and you can find several really good restaurants really, really close by that you can have some lunch and make some connections. But again, thank you to all our presenters, to Stephanie, to our counties, to Andy, and to our co-chairs and Carolyn and Pete and Donna and everybody else that attended. We appreciate all of you. Thank you.